stuff. And I can tell you, yes, it is live stream. Thank you so much. Thank you so much. Thank you, sir. So, you know what? Electrotherapy, what I have found in my opinion and in my view, every one of us use. But again, every one of us underrate also. I mean to say, if someone asks you whether you use electrotherapy, you will say, yeah, I use it. But you don't use it with a confidence. I mean, not every one of you, but yeah, most of you, that they don't use it with a confidence. I mean to say, a person walked into my clinic with neck pain. Again, I'll give IFT, I'll give TENS, and I can tell you that multiple prescriptions I have found for the patient in older days, whenever they have done the exercises and that they have taken physiotherapy at various places, I have seen listing all the machines. And it is a surprise to me that, like 15 minutes of ultrasound and 25 minutes of IFT, and the same patient is getting even TENS also. There are many who are getting SWD also. There are few, they are getting even cryotherapy also. I don't understand. I mean, everything you cannot give. In a discussion, I think about 2 years before, when I was having in a class, I was saying, how can we give everything to the patient? So one of my junior, he answered well. He said, sir, we are giving so that anything will work. Anything cannot work. Yes, Sarvanan, you are right. Most of the people, they are not using electrotherapy in a proper and correct way. You are rightly saying. Now, just for an example, since we all students of physiotherapy have aggregated at this platform, and we are going to talk, something new. So I'm just discussing. I'm also a student like you. Obviously, I'm in the position to have interaction with you today. But yeah, obviously, I consider myself a student and learner in the quantum science. So what I believe that suppose a patient, he walked into my clinic. It's just a simple question, right? Into my clinic. He has neck pain, and you suggested him maybe ultrasound and some IFT, and then of course with stimulation his pain will come down, no doubt about it. His pain will definitely come down. He's okay, doctor, you're too good, and my pain is reduced. Again, he may get pain after 17 days or 15 days or a month. Why? Because you have not prescribed him the proper, not just exercise, proper daily ergonomics. Not exercise. I'm not saying you're expert in that. You are suggesting exercise, but you are not suggesting him proper how to keep the neck, how to use mobile, how to use laptop, how to use tabletop, anything. Okay. That happens, number one. Number two, come to different things. Suppose somebody has a abdominal surgery, XYZ abdominal surgery. Lack of rehab doubt, correct. So now, yes, Siva, you're right. I'll come to your point in just a minute. Well, now what I was saying, you suppose somebody has surgery, abdominal surgery because of XYZ reason. Let us say it's a lower abdominal surgery. So lower abdominal surgery, what actually you work more for? Students, third year, please tell. What do you work more for, lower and upper abdominal surgery? What is the contrasting difference? In upper abdominal surgeries, we focus more on the breathing pattern. Okay, so that the breathing should not get affected. But in lower abdominal surgeries, what do we focus for? We focus for more of the gait. You're right, Upasana. We focus more for the lower limbs and gait. Well, so in either of the condition, there is a problem that there will be definitely pain, because visceral, you know very well that these all are sensitive tissues. So you have pain receptors, which is very sensitive. So we actually do TENS, right? Few of us, we know that we do the TENS. There is a type of TENS we'll discuss today about that type of TENS, which actually work for the post-surgical cases, right? So we are using for about, say, for example, 20 to 25 minutes, and then on a regular basis, and pain comes down. That helps us in getting lower limb activity. And as Upasana said, gait part will come after lower limb gets certain strength and endurance. So that is how electrotherapy helps you to come out of the problem. Well, now my question is very simple. Today we are going to see only current and ultrasound, of course, in our elementary class. As I told you, like complete class, if you want to get enrolled, please enroll in the complete class whenever it starts. And that will rightly from the current to everything, it will complete, not just the modalities listed in our electrotherapy book. It will be considering even PMF. I will go through the like cardiopulmonary stuff. I will let you know about all decompression, everything. So, like you'll have a fair idea of whatever is going in the medical world and what we are doing the best out of this, right? Now, taking class of electrotherapy not honoring the scientists like Einstein and Max Planck, all those will be I feel it will be a crime, because they are the one who has set the stage of the quantum physics, and they are the one who must be honored in our, I personally believe in my every class, either it's a physical, face-to-face class, or in the online, I always honor those great people, right from India to abroad, everywhere, who actually set the stage of quantum science. Okay, why quantum physics? Because they actually let us know, look, it is not just medicine. Even the frequencies play very, very big role, right? Intensities plays very, very big role. You have to just modulate and take the particular intensity for this. Today, we are going to see the type of current, and current will be totally hilarious chapter. You'll be coming to know like how do we actually even improve the range of motion through certain type of current. Of course, you may have certain machines, and my sincere request to you all that please don't ask me or MRA's man number about the brand of the machine you need to purchase. Please don't ask, because I personally don't endorse any brand, and we are completely away from that. My idea is to let you know how things work. My idea is to let you know how these modalities help our fraternity. Okay, my idea is not to advertise anyone. I'm very, very clear about it. I don't endorse any company, any individual, any affiliate, to be very, very precise. So kindly don't ask me, because in every class, after the class or during the class, I'll be getting personal message, sir, which brand ultrasound to write it. So today we'll be discussing about the ultrasound also, and I'll let you know how to check ultrasound. All of you know, I know, but what to actually check when you are purchasing your machine, those all things you ask your dealer or marketing guy, and you get satisfied and get purchase. Okay, any company it could be. I'm not into that, or none of our MRA person, to be very precise. Well, now coming to the topic. So we are going to learn electrotherapy. As I told you, like current, I will be sharing my, just 1 minute. I'll be sharing elementary. Yes, I'm able to share. Yes, that's good. Elementary level. Yes, I think it's being shared, and this is what electrotherapy in physical rehabilitation. So that's the reason I have chosen this topic, electrotherapy in physical rehabilitation. I have not chosen the topic saying that electrotherapy in daily practice or something. No, it is a part of our physical rehabilitation. One of you just told in the chat that physical rehab is not taught well. Yes, true, because this is the part of the rehab where we need to consider. Okay, if you are doing the treatment for a element like a lesion, especially say for example, if you're doing the treatment for the paraplegia, you consider current, right? So how can we just ignore this very science? Okay, well, now let us come. So we are going to see yes, we are going to see basic concepts and foundations, few of the modalities. In modalities also, we need to check out biophysics and clinical applications. Then we'll be having, like a rationale. What is our rationale behind choosing any apparatus? If you're choosing ultrasound for particular condition, why? Suppose somebody has a heel pain since 2 years. Will you use the ultrasound in a single intensity? No. This is what we are going to see. What to choose when. Otherwise, even the class 10th or 12th pass student will do in a clinic that. Then what is the difference between you and them? The difference is you are choosing as per the condition. The difference is you know which type of tense to use where. Okay, not every tense is useful everywhere. Well, now after that we'll have certain case studies and questionnaires also, and I will give you a chance of talking that. Uh, like I'll be asking you certain questions and you need to answer. And you know, these all questions are not bookish questions, so these all will be our depending upon this. And my sincere request to all of you that please switch on the video. If video is not switched on, the tech team will remove you from the class. Is my sincere request to please switch on your video. This is a complete, very clear order from CEO sir that if your video is not switched on, it is considered that you are not concentrated in the class, you are doing something else. You could be doing something else. So please switch on your video. If video is not on, you might be removed at any point of time. And I'm sorry to say that you may not be able to join easily. And that is the one. And second thing, your certificates may not come. So just see that I just wanted to explain you about it. Well, now learning outcomes we discussed. Now see, use of electrophysical agents, as I told you, it's very wide in especially in our electrotherapy, in the physical rehabilitation. It's quite wide, and we are so it's like in field of physical medicine, and especially in the athlete training. I mean to say, most of you know about this current of, like, you know, Russian current. All these people, you know, they are using the athlete training also. Even some of the chiropractic practitioners they are using. I am not into chiropractic, so I don't know much about like how do they really use the current in chiropractic, but yeah, they are using it. And of course our sport medicine, which is really very, very important. Okay, so in hardly 10 or 12 years before, it is the WCPT, World Confederation of Physical Therapy. I believe that the name has been changed now. So World Confederation of Physical Therapy, yes. So they actually admitted that it should be the another subgroup in the same area. Okay, so another subgroup in the same area. Idea was very simple, to make it as a like complete, you know, to work for the particularly for the physical therapist. So ISEAPT, International Society for Electrophysical Agents in Physical Therapy. Electrophysical agents in physical therapy. Why electrophysical agents? Okay, we will understand that anyway. Now, purpose of this society is to usually to promote worldwide uses of electrophysical agents by providing educational materials as well as the related information and news on this subject of interest to its members. Okay, now this was the general talk. Now let us come straight forward and classify the electrophysical stuffs. Okay, so therapeutic electrophysical agents, you know, we have a classification. We have a strong classification about it, and then we are using the thermotherapy, like, you know, these all are coming into the thermal, where the heat is used, and thermotherapy. Then you have a cryotherapy also, hydrotherapy. Now cryotherapy, you'll ask, of course, it is a matter of heat. It's not a matter of like hot and cold. Okay, so cryotherapy comes into this section. Now come to the mechanical section. Mechanical section is very, very important, where you have a spinal traction, then you have a limb compression, you have a continuous passive motion machine. You know, many people, they were using earlier for knee surgeries and even after TKR and all, just to getting the range. And then of course you have an ultrasound, don't get confused, it is in mechanical category, and then extracorporeal shock wave therapy. So all these are there in our classification part. And next classification, when we will see, it is a electrotherapy, physical agents classification, then the pure electrical, which is the most core, and this will be discussed by, for this is a discussion topic for today. Obviously, iontophoresis also we'll talk about certain agents which we use in the iontophoresis, then electromagnetic, which you say have the high frequency current, and then using for the short wave diathermy, low level laser therapy, and even ultraviolet. So these all are the classification, basic classification of the electrophysical agents. There will be definitely things will be chosen based on the requirements, but again, this is very, very important. Now, evidence-based practice. Okay, we will talk about the evidence-based. Well, evidence-based means, suppose like you have a clinical decision making, okay, how to go ahead. So this is the key part you can go for. Okay, how? Obviously, formulate the case history, online case based on the ICF framework. You will come to know what is ICF. Online therapeutic goals and outcome measurements. Okay, justify the electrophysical agents based on the EBP framework. I mean to say evidence-based practice. And then you have an outline key intervention of parameters, very, very important. Then you have to have a pre and post intervention outcomes. Okay, very, very important, pre and post intervention outcomes. And then you have to document in either soft or hard copy. What is that? SOAP, subjective, objective, assessment, and planning. Very simple. Now, coming to this. Now, before we get into the electrophysical apparatus like the current or anything, we'll be talking about certain physiology. We'll be revising, in fact, certain physiology like Pan-Gate mechanism, soft tissue healing process. Why? Reason behind that, when we start, like that time when we talk about anything, we should have one idea like how do we work for that. Okay. Now, soft tissue healing process. Okay. Soft tissue healing process. As all of you know about it, that soft tissue healing process goes in certain phase. So, however, it is always an innate capacity of the body, your immunity part, your protein content in the body, everything that, like perfectly works for how soft tissue get healed properly. But again, to be very precise, we have a 4 phase, second year pathology. Every one of us, we know about it. The first phase is homeostasis phase, where you're on emergency response to the pathology, which is to prevent just to bleeding. Okay, it can happen for few seconds also, and it can go for minutes also, right? So few have a more bleeding time. Now, inflammatory phase, crucial phase with symptoms span over hours, days, or weeks. This is where your things come in picture. What is that? Inflammatory. Now, proliferative phase. What is proliferative phase? Concerned with the formation of new and immature repair tissues happen in weeks and months. All of you, whoever is a very good, in terms of ortho, they'll be knowing about it. It's very, very important, right? So now last is a remodeling and maturation phase. So remodeling and maturation phase is something, suppose a bone has been formed. I'm just giving you an example. Suppose one bone has been formed. So how it has formed? It is formed properly or not? So after that, the remodeling part will come in picture. Okay. So the tissues will be remodeled. Here, I am stressing on this particular part. Reason behind is, suppose somebody has a ligament injury. Okay. Ligament repair. More than injury, I can tell you that it's a 3rd grade injury or 4th grade injury, and there is a repair. Obviously, you did cryotherapy, you did certain ultrasound and everything. Why do you exercise? Any one of you can answer? Why do you exercise? Don't tell me just to strengthen muscle. No, I know that answer you can give in third year or final year. Practitioners, please tell, why do you exercise? Just type in the chat. I would be able to see, no problem. Why do we exercise? I'll wait because this is important. I'm not talking about bone. I'm talking about just ligament, soft tissue. Forget about bone. Right now, we are not talking about bone. We are talking about ligament. I'll check. To prevent neuromuscular coordination and proprioception. Nice. To increase collagen. Somebody has told to increase collagen. Who is this? Karthik Raja. You're right. Blood supply. All blood supply and all. These are the physical stuff. Like this is a physiological thing. If you don't do, also help in tissue healing. That's what Manish Soni. My question was why? What is the reason? Like, how do you see for the tissue healing? Conditioning of the structure, little blunt answer, Arti, little you can be more precise. But Karthik Raja, you are totally correct and 100% correct to increase collagen. Now, I would actually exemplify in a normal way so that, you know, it doesn't to increase mortality and collagen. Very nice. So, Sakura, very nice. To maintain joint function. Okay. Well, now let us talk. See, there are two methods. Okay, there are two methods. One is, I'm making it very simple. Okay, for all of you, you will understand it easily. To make it very simple, you should understand there is something called fibrous tissue. Okay, fibrous tissue. But there is something called collagen. Okay, collagen is a specific tissue, and there is something called elastin. Right? So fibrous and then elastin. So basically when we divide it, just 1 minute. Okay. So basically when we divide it, we can actually say either it is a fiber or it is a elastic, right? Either it's a fiber or it is a elastic. So being a physio, what is your work? To prevent more of fibrous tissue formation so that more and more elasticity can be achieved, right? Right? Collagen is what? It's elastic stuff, right? I mean, it's a connective tissue. Sorry, it's a protein. Work for your connective tissue. Well, now, if it is a fibrous, what is the problem? Suppose my elbow has a issue. Okay, and it is not mobilized properly. One of you told about the function also, right? To maintain joint function. Very nicely said, but you should be a little more precise. So what I'm saying you, that you are not mobilizing it. Why physio is important? You are mobilizing, you are increasing collagen, and you are maintaining the connective tissue property for particular ligament. Well, ligaments are connective tissue. Any doubt? Any one of you? I think I'm right. Okay, so it is a connective tissue. You are maintaining what? You are maintaining, you are able to bring the proper elasticity. So it is very, very important. So before starting any of the machine, I thought to have a word with you. So fibrous to elastic. I mean, we cannot let it go fibrous. If you are not mobilizing, more fibrous tissue will be formed. You know very well, fibrous tissues are harder. So if any tissue is harder, you will not be in future, it will be very, very difficult. In my practice, I have found, and you can answer anyway, in my practice, I have found few cases, not all, nowadays tech is very good, physios are very good, but still few cases where they have like extension lag in terms of, I'm talking about after post TKR extension lag. Can any one of you answer post TKR extension lag? Not because of weakness of quadricep. This extension lag, or I'm making it even more simple, that end feel, if you, every one of you know, not simple, little complex. Anyway, forget about it. So now quadricep has a good power, but still you don't see that the knee is straight even post TKR after a month. So what could be the reason? Reason is that initial phase, when it was supposed to be bent, when it was supposed to be mobilized, patient cried or whatever be the reason, it was not done in a proper range. Correct? Now, as you know, many of us, I think about 60 to 70% of people have tight hamstring. Okay. Now hamstring is overactive. Quadricep is still lengthened. Any muscle which is in lengthening position for a very long time, what happens? It produces weakness. Well, now quadricep is tight. Tight is what? Because of what? Since it was not moved in a proper range, it wasn't moved in a complete range. That's where it developed tightness. Well, it developed. Now, that's the reason a good physio don't consider only the muscle strength a core thing. He consider even the length of the muscle in a very serious manner. Length of the muscle in provided context, in provided like condition, how good the muscle length is there, it's very, very, very important. If muscle length you are not able to get properly, let me tell you, even though you get very good strength, your joint range of motion is not complete. It's going to affect his ADLs. Why did I say ADL? It might affect his ADL. Why ADL? Because it could be even for the hand, it could be even for the leg, anywhere it is. And this is seen most on the post knee surgery, especially the large joint. It is seen even most where post ankle issues, post your ankle injuries, mostly post-surgical injuries. Why? Because of a lot of fiber is formed. So I actually brought this particular second year chapter to your revision today. Only and only reason is to give you insight and to have a revision. So many of you are really very active, but I don't see still many videos are on. So anyway, not a problem. I already informed. Yeah. So all this phase we will see even in the picture later. So of course, these all are small things. So how EPS help? I mean, how electrotherapy help? Usually, as I told you, like tissue healing occurs via what? Via regeneration and repair mechanism. Qualities of soft tissue healing may be defined as ideal, acceptable, minimal, and failed. See, this is the classification of quality of soft tissue healing. Okay, so you seeing the patient, you can say either it's an ideal or acceptable, minimal, or failed. If it is failed, you have to work hard. If it is minimal, maybe your smart work may bring it very well. If it is acceptable, you have always chances to go for the ideal. So your idea is to make it ideal to the fullest. Okay, skin, bone, and skeletal muscles have the healing due to better vascularization. That is our blessed from the God. And then of course, all electrotherapy usually increases what? Chances of soft tissue healing by targeting specific phases. So your electrotherapy should be according to your phase. Well, we will be discussing this. We'll be discussing this when we come more into there is an important question somebody has asked me. Just a minute. Somebody asked me one question because he's not able to see the stuff. Just 1 minute. I will. Okay, let them. Sorry, few of you that they could not use on the YouTube, so they are just saying that not able to join. Okay, no problem. So now coming to our part. So what is our main idea is what we were talking about. Our main idea is to go for the ideal anywhere between ideal to acceptable. Okay, no matter what, this is our goal should be get. Okay, what I was talking about electrotherapy in different phase, what do I mean? I mean to say in acute, your electrotherapy decisions should be different. Your choose your like selection of electrotherapy modalities based on your conditions. If it is a chronic, obviously different. Now let us see this in a picture, informative picture, which is really important. When we see picture, we remember for very, very long time. So this is how you can see in this picture, in this, it is actually given. The first phase where the like the platelets, fibrin, everything increases, and then the basically coagulation happens. Then the second phase comes where the immune infiltration very, very importantly comes, and pathogen killing also happens in this phase. Well, your neutrophils, lymphocytes, all these mediators come here. And then there is a proliferation phase, which is very, very important, where your fiber comes for very first time for healing, fibroblast proliferation. And then scar formation starts. You know, scar formation is equally very important. Then collagen synthesis, very, very important. Third phase, angiogenesis. So I mean to say that third phase, your choice of electrophysical agents along with the exercise therapy is the key to bring the best outcome in your patient possible. Now the remodeling, where the exercises part will be more, and depending upon the symptoms, you can choose the electrotherapy where epithelialization happens, and then scar maturation and contraction happens. Okay, then apoptosis. So scar formation and maturation is equally important, because scar maturation only will bring the tissue, you know, like in a better healing position. You all can remember the chronic inflammation from second year of pathology in physiotherapy subject in bachelor. Many of you have joined here who are students, so for that their understanding I'm telling you. Now this is again my favorite and very, very important topic. Favorite, I mean to say, not in a different way, favorite in terms of like making you understand. And I'll check some of you have sent me certain induced collagen formation and explained by Wolff's law. Very nice. Sir, can we get PPT? Well, PPT, I will check. If PPT is done, then after 72 hours only it can be. You want PPT as a student? Yes. Okay, you can get it. I have no issues. I think PPT is already there. I will check it, edit and send to you. That's not a problem. Apart from that, you will always on the YouTube, it will be there on the YouTube. It's always good to see the video and revise your classes. As many number of times you want to watch, you can watch. Right now it is live, and after that it will be there on the YouTube forever. So now understanding pain. Okay, well, understanding pain, it is very, very important when we talk about pain. What is pain? Basically everywhere they say, and this is the most important thing which we actually see in the clinic, right? Most of the people, they come either with a pain or any kind of unpleasant sensation. So how do we define pain? Pain is defined as unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damages. This is a definition from the book. But how do you define pain? Because I believe that perception of pain is different. Perception of understanding of pain. Sivaji, you can speak to the group later, or you can send the mail. We'll be letting you know, not now. Yeah. So understanding of pain for different person is different. You know why it is different? Do you really know? I'll tell you. Perception of pain for me and for you, it could be different. Reason behind your pain threshold could be different. My pain threshold could be very low. So even the small things come to me, I'll be explaining more. Why? Because I'm getting it. And somebody having a lot of back pain past 20 years, they are like struggling, still they will not tell it's troubling them. Somebody, right? Pain is a signal that says something is wrong, right? You can make it more clinical word, like it's a symptoms, not disease. Well, now this pain puzzle, when we talk about pain puzzling, so it occurs, like it may occur without injury or biologic purpose, or injury without pain. I mean to say without injury also, without any biologic purpose. See, when we say like a purpose, there is a lot of meaning into that. I will not get into, but yeah, it is possible to happen pain without any seen injury. It is possible to happen, right? So pain may be acute or chronic, as every one of you know. I should not explain that. Acute and chronic, in fact, subacute also. And then now we will be dividing pain for our physiotherapy, electrotherapy detailing. So it can be categorized as nociceptive, neuropathic, psychogenic, and carcinogenic. We'll be talking where physiotherapy works. So that time we will be talking like which kind of pain can be treated. Not everything, every pain cannot be treated by physiotherapy. To be very clear, we have also our limitations. Like electrotherapy has limitation. Now electrotherapy cannot treat anybody having a psychogenic pain. Clear, very clear. So where actually we are working? We are working more on the nociceptive, basically, right? Okay. Now, anyway, we'll be seeing these things in detail. Pain is a four-dimensional process involving intensity, quality, effect, and location. All of you should understand. Either intensity, then it is a quality, then it is an effect, how it is affecting you, and then location. These things, it's a four-dimensional stuff where we are seeing any kind of pain. Okay. Now, there could be different pain assessment. I'm not getting into pain assessment because pain assessment is another chapter where either me or any senior lecturer will be taking one day. That is there in the course bundle. Many of you have purchased it. So when it starts from, I think, July first week, it will going to start. So in that there is a, I think, pen also, they have selected one topic. So one, either me or one of the senior professor will come to explain you about pen. That's a different purpose. And pen for physiotherapy, how do we define? And then pen, like how do we take pen assessment? But to be very short, how do you take pen assessment? What all things you see in the pen? Definitely you see the intensity, you see the quality of pen. I mean, as a dull, acute, sharp, needling, what kind of pen you have, or you see the effect, how it is affecting your ADLs, right? Then you see the location, right? Then you see the location, of course, site. Now, apart from the site of the pain, we check what all the factors which aggravate your pain, what all the factors which decreases your pain, what are the factors, I mean to say, what are the relieving factors, what are the aggravating factors, right? That's how we take the pain assessment, right? How either it's the insidious, what is the onset of pain? Do you get pain in early morning? Suppose somebody has a frozen shoulder in subacute phase, he'll be explaining you, what, sir, when I get up in the morning, it is painful. Most of the shoulder pain is painful in the morning. Most of the shoulder pain, I think all of you had attended last time the shoulder conference. Beautifully it was done. Shoulder class. In that, all of you learned this. This is true. Okay. So now in onset of the pain is very, very important. Somebody will say, sir, when I start walking, there is no pain. When I start working by sitting, yes, I get pain. Right? So these all are very, very important. Like when the pen comes, when it is not there, we all will see these all pen factor in pictorial methods also. But for like right now, subjectively, let us see. So nociceptive pen. What does it mean by nociceptive pen? It actually arises from actual or threatened damage to non-neural tissue and activation of nociceptors. So nociceptors are the kind of receptors. And wherever, suppose I am having a hurt here, I got hurt at my elbow or shoulder, the pain will come directly from there. Okay. And it has a high threshold sensory receptors, and belongs to the part of course, somatosensory nervous system, and that are capable of transducing and encoding what? Noxious stimulus. I mean to say, these kind of stimulus are well enough to damage to in general tissues like leg, hand, everywhere. Okay. Now, here we will be dividing in two parts. One is the somatic. All of you know what is somatic. If you don't know what is somatic pain, you can again get revised with me, no problem. Somatic pain, it actually comes from where? Nociceptors, but exception of neural tissues. Okay. And it is caused by injuries or maybe certain disease. could be chronic disease also, and it is one of the most common pain, especially after post surgery also it happens. Okay, so these all are somatic body pain, I mean to say body pain. Okay, and it actually matches the type of stimulus. I mean to say, suppose my pin is there, pain is there, I am poking to my hand, so it, you can say yes, there is a sharp feeling. So you are able to, like your pain will be matching your stimulus. Suppose I'm actually blunting myself with some blunt subject like this, I got hurt with certain, like right now it's a mobile, but anyway it could be even else. So okay, in that case you will say no, it's like look like a blunt has hurt it. Well, so you can actually, your pain will match to the type of stimulus. How do you say that? Yeah, I got a thrown while plucking the rose. You're able to see that, right? Yeah. So this kind of pain, it's very good to work with our electrophysical modalities. It works wonderful because it is a somatic pain. Now visceral pain, one of the most nociceptive pain, which is one of the most challenging, I always believe, is the visceral pain. Visceral pain, it is through the activation of nociceptors, but where? Sometimes back we were talking about post-abdominal surgeries, right? Nociceptors in viscera. Okay, here more than injury, the disease is something which causes. Okay, disease which causes the pain, not injuries. Obviously, if somebody has hurt in through any road traffic accident or something, obviously abdomen will pain because it is also the skeletal muscle, but it is most of the time, many a times in fact, it is the disease which cause pain rather than any external stimulus. Okay, so and we say that a referred pain. Okay, referred pain, very good, very nice word for this, referred pain. Why it is a referred pain? Because pain is happening somewhere else. Pain is happening in viscera somewhere else. Pain is happening and you are able to see the symptoms somewhere else. I mean to say, suppose somebody has angina. Okay, it is where it is perceived, left or right part of the chest, obviously little left. Okay, and then of course in the left arm, in here also, in this area also it could go between the scapula as well, it could be, right? And many people, they are even feeling in the wrist and up to the fingers, I mean talking about left hand, yeah, up to the fingers as well. So this is the angina pain, and this is one of the referred pain. Why? Because there, if you see in the properly the supply, nerve supply, especially the cutaneous supply, the right from the cervical third to thoracic 5 vertebra, nociceptive afferents from the heart enter spinal cord through the dorsal root of C3 and T5 only. So the feeling of the pain will be from different part. Okay, now disease of lung, liver, kidney are largely painless. Why? Until becoming severely impaired, but minor lesion in bladder and abdomen can be more painful. Okay, so it depends upon the site and location. It is like this. Okay, moreover, as I told you, it's a referred pain, so our scope becomes little limited. You should know where the pain is. Well, and nociceptive, as you know, the somatic is the most common. Now we are talking about neuropathic pain. Neuropathic pain is a 2 marks question. Is a 2 marks question nowadays in Rajiv Gandhi University? I think it has been now 3 marks. I'm not sure. I have not seen. I think 3 marks only. 2 marks or 3 marks, but very short answer it comes in neuropathic pain. So it is what? It is caused by the lesion or damage to the somatosensory nervous system and often characterized by array of abnormal painful sensation of the chronic condition like allodynia. Okay, it could be peripheral, it could be central, peripheral results from pathologic injuries to the peripheral nervous system. Okay, it could be motor and sensory both, because in periphery everything is there. Now central nervous system like functioning of cortex, midbrain, pons, medulla, all this it can cause. But Cases like stroke, Parkinson, it may take years. How many of you have heard of thalamic pen? How many of you have heard? Thalamic pen. I will not ask what is thalamic pen much today, because it's a matter of neuro. So in neuro class, your lecturer will ask you, not me. Thalamic pen. One of the most excruciating pain in the world is what? Thalamic pain. It is a type of which pain? Central neuropathic pain. Clear? Well, how many of you have heard of or you have seen the case of trigeminal neuralgia? Trigeminal neuralgia. Very painful, right? So, yes, seen. Very nice. Seen. Yes, yes, yes. Very nice. Very nice. Good answers. I'm loving the interactions. Seriously, seriously. This batch is wonderful today. So, no, peripheral type you can work with, but central you can't work with. You can't work with. You have limitations. You can't work with your electrotherapy modalities with your central pen type. Okay. Now, let us see different pen also. At least we can see. We cannot do anything, but we'll have to see. Yeah. Psychogenic. Psychogenic is because of what? It is a non-organic psychological sources. I'm not laughing because of the pain. I'm just laughing. It presented a different symptoms, so frequently associated with what? Cognitive or emotional behavioral responses. Okay. Its management is not possible through electrotherapy, to be very precise. Now, it could be because of cognitive or behavioral responses. Person in the depression, past 3 years, not moving anywhere out of his room. What we will face? You will say to come, we'll have some like walk in the park. He may answer, no, my back is paining. It could be excuse in early stage and later thinking that my back is paining. So it may be pain also. So these all we say as psychogenic pain. It is an incident. I mean, it could be various incidents. I have seen many cases of psychogenic pain. One of the case came quite some time back. That lady came to my clinic and I asked, like, what is your problem? She said, like, I have fear. And I was doing something, not looking away, not looking at her. I just told, ma'am, if there is a fear in you, then I'm not the right person to contact for you. Then I said that for fear, you should go somewhere else, not me. Possibly you might go to any psychologist or psychiatrist because you are having a fear. No. I have come here for physiotherapy because I am having a pain in the leg. That's what her answer was. I asked, what kind of pain you have? She said that I'm having pain in the leg, I'm having pain in the hip, I'm having pain in the thigh. I mean, basically both the legs. She thought, yeah, both the legs. Okay, more in right or more in left? I was also new, so those days, so took good assessment. Anyway, very subjective. She said, like, she is guessing and answering. I asked, like, how it started. Do you know what was the answer? And it surprised me. The answer was, I was walking normally, and past 2 months, only once, 2 months before, I fell on the footpath, pedestrian. And after that, I'm having a fear that whenever I walk, I'll fall. So this was the answer. So I want my physiotherapy in such a way that my legs get even more stronger, or whatever you do, but I should not fall. I checked it. All the limb muscles, 4 out of 5. Everything is okay. Range of motion. Everything is okay. No swelling, nothing. Then what has it? Psychology. So psychogenic pain. So seriously speaking, which method I used to, I did with her, and after 10 days she was more happy. That is not a part of today's class, so I will not talk. Today's class is electrotherapy. I just told you example, one case history. I told you live case history which I have seen, the case of psychogenic pain. Okay, likewise I saw even later many cases, but this was the case which I saw in a very very active manner, and then I found that really psychogenic pain is something which is a very big problem. Now last is carcinogenic pain. Of course, as the name suggests, it's a presence of carcinous pathology anywhere in the body, and practically we are not using EPAs for treating such kind of pain practically. Now the thing is, like, if your surgeon suggests post, you can use obviously, but post surgery and all, not definitely. Practically we don't do that in carcinogenic pain. Now how do we experience the somatic pain? Our physiotherapy mostly works on somatic pain. So like, how do we actually, just 1 minute, yeah, how do we experience that? We actually experience, there are certain process we are experiencing through the transduction. We are experiencing, every one of you know, we are having a peripheral transmission, and then we have a modulation, we have a central transmission, and at last we have a perception phase. Through these 4 phase we actually see the pain, right? We actually perceive the pain, sorry. So these all are the process: transduction, transmission, modulation, and perception. Transduction, usually what happens, any kind of energy, any kind of receptors, nociceptors, which convert into the, if we say in terms of quantum physics, yes, it converts into the electrical energy, and it generates action potential. Basically that leads to the nerve of pulse, and that leads basically the impulse of that type. Now peripheral transmission, what happened here? The nerve impulses which are generated from nociceptors, it goes to the spinal cord through 2 distinct afferent sensory nerve fibers. You all know A delta and C fibers. Okay, so A delta is usually faster, and it constitutes the first order neuron. Why it is important to know? So that you can understand the difference between fibers, and then you can use accordingly as per your condition. Now modulation is what? It's nothing, it's a suppression or amplification of the pain in this particular stage, and then here the emotion effects. Yes. Now central transmission, it is an ascending transmission. It's a projection of nociceptive. Suppose here there is an injury, it will be propagate, it will be magnified, sorry, it will be perceived. Okay, and generally we say that T neuron which actually generate this, and then after that it goes through the anterior, tell me, anterolateral system, ALS, to the brain and cortex areas, where we later stage we perceive. But before that, if you go into more detail, it is the second order neuron. It's a second order neuron, and then if you go more into detail, as every one of you know, it first get transmitted from spinal cord to medulla, and then of course pons. So this is how it ascending it works. First from the, like, you can say it is just 1 minute. First level, it will be the from here it will first order, what we are talking about, the second order neuron. So anterolateral system, nerve impulses are first transmitted centrally from spinal cord to up. Okay, so first will be the medulla, M, and then after that it will be pons, P, and then midbrain, MB, and then of course it will be going to the lateral part of through the lateral midbrain, along anterior and lateral part of the ALS. Okay, now it will be going to the subcortical areas, And this is where it will be able to detect pain, like the best we can say the limbic system is a very big this one neurophysiology. You can understand about limbic system. There are a lot of things about it nowadays. Nucleus, Raphe RM nucleus, we say Raphe Magnus nucleus, where this like this modulate and this understand. And then PAG, pre aqueductal gray matter also. And then it particular ALS is a wide spectrum stuff, means it is made of various specific pathways like spanothalamic, spinoreticular, mesencephalic tract, and these pathways are serving different function. Okay, so subcortical neuron, what we say as a third order neuron, and third order neuron is what it actually a new set of impulses that generate and it transmitted to cortical neurons, that we say as a fourth and last, what we say the fourth order neuron for final perception. So after first, second, third, fourth neuron, you can see in the notes, if it will be given as a PPT, you can see, and then you will have a perception phase where the pain is perceived and you can detect according to the nociceptive area. Suppose a mosquito come here and bite me, how without seeing also I can hit this? This is because the fourth order neuron has clearly sent the signal in the perception phase, and where we are able to understand this is the site, and we try to take the try to keep the mosquito away or kill also sometimes. So it is becoming a cognitive effect. So you are able to understand either mosquito is biting or any nail is going or anything is going, right? This is how it works in general. And somatosensory cortex is most important for spatial and temporal features, location and duration of pain, where the limbic and paralimbic regions are most important for emotional and motivational aspect of the pain. As soon as we perceive the pain, we try to modulate downward. That is the descending pathway, attempt to suppress by acting on it. Unfortunately, pain can modulate up and amplify too. It is the natural process. So in general, if you see in a normal picture, it is like this, right from the injury part, right from the part where it is injured. Suppose I'm having a problem in my palm, and this is what has been shown here. It has been exemplified by, suppose there is a pain injury part here, and then it get transduced and through the peripheral nerve to here, and then you have, of course, what we were talking about, A delta and C fibers. A delta carries very fast, C fiber is slower, A beta fiber is also there, and that will go to the dorsal horn of spinal cord, and then from here it will follow the ascending pathways, what we were talking about, medulla pons and midbrain, and then it will be going to the subcortical level, and then cortical level, and finally as the perception level. So where you are able to understand what kind of injury it is. So this is the beauty of nociceptive. Here I have taken an image, and that is good for the student to learn ascending and descending pathways in a normal way. Even now this picture is particularly I found very important, so I selected for you. And before discussing anything in the electrotherapy, I always use this picture. The reason behind is it is very clear method. Targets of pain therapies. Okay, so pharmacotherapy is for what? Pharmacotherapy is non-opioid pharmacotherapy is a for non-opioid analgesics, opioid analgesics, nerve blocks, adjuvant analgesics, neuropathic or musculoskeletal. This is what we are using the medications. There is nothing like a physiotherapy for this. Okay, but electrical stimulations, TENS, PENS, all these things we are using for the pain. And alternative method like your physical therapy exercises, chiropractic, surgery, acupuncture, all these are the alternative methods for pain therapy. So for pain, basically you are using this much. Nowadays, you have few doctors who are specialists in the pain. We say them pain specialist. I met one of them. So this is really a good thing. So before that, we'll check about the descending pain control. As I was telling you, it will come through like that only. Cingulate cortex, amygdala, you can actually remember all these things by seeing the PPT. Periaqueductal gray matter, where you have opioid receptors, projects to raphe nucleus, then you have a raphe nuclei, then at last you have a locus coeruleus, and then any kind of stress-induced analgesia, analgesia you can think of. So these all are the descending pen control method. This was the ascending pen control method, I mean target of pen therapies. And then you have a pen sensitization, which is very, very important topic. I think few of the universities, they have this question also, pen sensitization, but I'm not sure pen sensitization, how many of you really take in a very serious manner. See here what happened, like suppose there is a site of injury has happened, and then here peripheral sensitization is there, where the inflammatory mediators like histamine, SP, cytokines, bradykinin, there are a lot of this one inflammatory mediators come, and through the visceral efferent it will be going to the dorsal root ganglion, and at level of a spinal cord, the spinal cord is also the part of CNS, right? So it actually in the glial cells, it actually passes the impulses, and this is where what we say as a central sensitization. So my dear friends, after that, of course, this sensitization only goes up, and it actually feels peripheral and in central way, it feels the sensitization. So my dear friend, try to understand sensitization part. Now once you read about more of pen sensitization, then you will understand why I'm saying you this is important for the clinical part as well. Okay, apart from that, placebo effect, somebody asked me in the 2 years before when I was taking class, sir, how do the placebo works? Well, placebo, I have seen in many cases work. You also would have seen in many cases it works. How it works? It works exactly in the manner of, just a minute, I'll check so the chat has come. Sensory cortex emotional system, very nice. Okay, so it actually works as good as like normal medicine in many cases, but in terms of pain, it is more and more and more common. Okay, because your brain has a very strong pain suppressing agent. Just 1 minute. Just 1 minute. So I happen to choose this particular image for placebo context, and your brain has a very good to suppress pain. There are a lot of studies about pain, headache, how the placebo effect, and I can tell you that it has a significant effect. You also would have seen many a patient, when they feel that ultrasound is affecting to them, you don't increase the intensity, it even works in the same manner. If any one of you have seen, if any one of you have experienced, kindly share your experience, because I told you in initial minutes of our introduction, we student of physiotherapy here are to interact more than the interact and learn from each other. So the placebo context, if any one of you have seen, kindly message in the chat. So so either it's a non-opioid mediators or endogenous opioids, anything which actually causes for the pain. So nociceptive inputs, which is causing the pain. Now you are giving both for reducing the pain. Okay, if you don't give anything also, just seeing, suppose two medicines are there, one is just a sugar crystal and another is a medicine but looks alike, it works well, that is how we say that it's a placebo effect. It has been seen in many more people. Again, I'm repeating, any one of you have seen the placebo effect, please message in the chat, no problem. So we'll be breaking for a minute, for 2 minutes. In fact, it's 12:07, we are here by 12:09 or 10, and then we'll start the therapeutic ultrasound. So we are back. I'll share the screen, just 1 minute. Able to see? So now we will be able to see the ultrasound, therapeutic ultrasound, one of the very important topic. We'll be seeing ultrasound in a very minute detail, and you will be liking it not because that you are learning new thing. No, you may be knowing about it, but only thing is the most important part of knowing today's ultrasound is most important part is you'll be knowing about lot many benefits which actually works for you in terms of your academics also. Okay, well, now how many of you use ultrasound more and more? More and more, I mean to say, for every, I mean, you feel that ultrasound is a key apparatus to your clinic. How many of you feel that? And how many of you actually me? Very nice. Yeah, be very frank, no problem. Not in every case, of course, but yeah, inflammatory condition only during tenderness. Okay. Yes, very nice. It's always good to be honest. I can feel it. Very nice. So it says that ultrasound is one of the most important machine in our clinic. Well, now therapeutic ultrasound. Whenever we are talking about ultrasound in physiotherapy, we always think about therapeutic ultrasound. We are not talking anything which is like a, because ultrasound is even used for the diagnostic purpose, right? It's used for the diagnostic purpose. In fact, most of the patient many of the patient, in fact, earlier they were not knowing that it is even used for the treatment purpose. Anyway, so physiotherapy ultrasound is one of the most important machinery. Now let us have discussion which is very important, biophysical angle. Biophysical angle. So biophysical discussions, of course, we will be knowing about the physics of the ultrasound. So what is the ultrasound basically? So sound, what is sound? First, to know ultrasound, we'll talk about sound. Sound is a vibration. How it works? Compression and rarefaction. If any one of you remember this physics, compression and rarefaction. Compression and rarefaction. So any sound wave which works on the compression and rarefaction, okay, and audible range is what? 20,000 to 20,000 hertz. Audible range of sound is what a human being can hear is what? 20 to 20,000 hertz. Cool. And what is our speech range? Can anybody tell? Speech range. Yeah, any one of you. Speech range. Okay, it's a homework for you. So very simple. Sound waves below 20 hertz will be infrasound, and then above 20,000 hertz will be ultrasound hertz. Okay, ultrasound it will be. So what is 20 hertz? What is 20,000 hertz? So you know very well, hertz is basically the SI unit for the frequency. What is frequency? Number of oscillations in particular second. Okay, so suppose this is the oscillation, compression and rarefaction. In a second, how many times it goes? That is the frequency. Okay, so there are certain physics behind ultrasound which we need to learn before use of ultrasound. Okay, I'll be letting you know acute में क्या करना है, chronic में क्या करना चाहिए. Somebody in my break sent message that they are not comfortable with complete English, so they want me to speak in Hindi also. I'm sorry, I could not speak earlier Hindi. I actually forgot. Yes, क्या करना है क्या नहीं करना है मैं आपको बताऊंगा. And clinical applications definitely I will tell you at later. But before that, need to learn the physics of ultrasound. Well, now sound wave has certain qualities. Let us talk about it. Wavelength. What is wavelength? The distance over which the wave shape repeats, that is the wavelength. Okay. Frequency, number of oscillations. Amplitude or loudness, measure of its change over a single period. How much it changes, how much it is changing. Okay. That is the amplitude. After that, the sound. These all are things even in the most of the electromagnetic waves. But after that, which is very local, which is very integral part of the ultrasound, is what we need to learn about is quality of sound. You know, sound quality is very, very important. What we say, timbre. Okay. So quality, timbre is the quality of the sound which allows us to distinguish between different sound sources, okay, at the same pitch and loudness. A baby which is whistling during his playful moment, you can differentiate definitely from your kitchen's pressure cooker. You know, after getting cooked your food, obviously it whistles, which you can entirely, you know, like you can actually distinguish between the baby which is playing and then your own pressure cooker, right? So how actually you are differentiating it? You are able to differentiate. You are able to differentiate in terms of quality. So quality of the sound, which makes the more difference. Very, very important. These all points. If you don't understand these points, let me tell you, if you forget these points, using ultrasound is good, but yeah, knowing is even more better. So let us see this first. Yeah. So now we'll be talking some more properties. Transmission. Transmission. What is transmission? Transmission is like how sound moves. Sound or light, any wave, in fact, any electromagnetic wave, sound is different, but I'm telling you, any electromagnetic wave, the medium plays very important role in the speed of the wave. Right now, it's the part of sound. So let us talk about sound. So sound waves transmit differently in different medium. Compression, rarefaction, that happens differently in different medium. I mean to say, in air, the speed will be 340, right? And in liquid, in water, what is the speed? 1500 meter per second. All of us have learned in school. And in solid, like steel or iron, it will be 5,500 meter per second. Oh, okay. Here, 6,000. Okay, 6,000 meter per second. No problem. Anywhere between 5,000 to 500 to 6,000, depending upon the steel and iron quality. And the reflection. You know, just like light, it has also the reflection as a quality. Change in direction of a wave at an interface between two different media follows the basic rule of reflection. Basic rule of reflection, you all know. I will not get into that. Then refraction. In light also refraction happens. Here also light refraction happens. How it happens? The refraction, क्या मतलब है refraction का? The wave which is hitting from, say for example, air, now it is getting into water. Okay, it won't be going through the same direction. It will differ from it. Either it will be reduced or it will be increased depending upon the medium it is crossing. Okay, suppose from water to air, sound wave has gone, it won't follow the same direction. The direction will be different. Okay, so change in direction of acoustic waves when it passes from one to another media where speed is different. Okay, it follows Snell's law, you know very well, Snell's law from our class 7, class 9, even electrotherapy, Snell's law, ratio of sine angle of incident, and I mean to say, if it is a I in angle of incidence, then it's an, if it is a R angle of refraction, then sine I divided by sine R is always a constant. Okay, and this we say as a Snell's constant, refractive index. In light chapter, it is more detailed. Okay, refractive index. Okay, I will ask you one very good question after some time in this. Now the diffraction. Diffraction, what is diffraction? Diffraction of light, all of you understand, right? Diffraction is scattering. So here, sound wave also has a quality of diffraction. It's a change of, again, direction of acoustic wave. When they pass through, not a medium, they pass through certain obstacles. Obstacles कहने का मतलब है कि, just 1 minute, how you will see the diffraction when it will pass through certain aperture or obstacle, like how it works, I'll show you. Suppose this is a wall, okay, and this is an aperture here. Aperture means छोटा सा hole, ठीक है ना? Now sound wave is coming like this. Compression and rarefaction method में आ रहा है. This, when it is reaching to this, it can change the direction. Okay, it can change the direction. Why? Because it is passing through certain obstacles. कोई रुकावट से ये pass हो रहा है. This we that's the reason when you go near the corner or wall, you can actually hear what is happening that side more clearly. That is because of diffraction. There is a very famous saying, right? दीवालों के भी कान होते हैं, कुछ ऐसे ही है. I'm very poor in that. Yeah. Oh, somebody answered for human speech. We'll talk about this later. So, वो कहते हैं ना दीवालों के भी कान होते हैं, like that. So it's all because of diffraction. It's a physics. Okay, दीवालों के कोई कान नहीं है. It's a natural laws. Well, now absorption. Okay, this is also very important part. So absorption की जब बात होगी, I'll ask you one question, very important question, and most of you have to answer me today. I'll be very happy if I know the answer, reason behind, then I'll understand that we all students are more devoted and committed toward not just clinical practice, we are committed even towards the physics which is happening around. Okay, well, acoustics. Acoustic absorption refers to the process by which a material takes in the sound energy. ठीक है, अभी आपके, where I'm talking from my room, where I'm actually live streaming the class, there are many curtains. Okay, there are many curtains. There is a wood, you can see behind, there is cloth curtain, there is a sidewise curtain, there's a wooden door. So this will absorb the sound wave. This will not reflect the sound wave. Okay, it will be absorbed. However, you know very well, any energy can never be destroyed, it always changes the form, right? Energy can never be destroyed. It can always change the form. It can be into the heat, or it can be absorbed through absorbing body in a different way, transmitted through that absorbing body. But it is not lost. And moreover, the there is a word called acoustic impedances. Okay, acoustic impedances, and you should learn about acoustic impedances, because this is playing very, very big role when it comes to ultrasound. Or both media is a function of frequency and incident angle. We'll not get into physics much. Sound absorption coefficient is the fraction of sound energy absorbed by the material. Very cool. Absorption coefficients are tissue and frequency specific. Higher with the higher collagen content tissues. Always remember, increase in proportion of the ultrasound frequency. Well, more the frequency, more the absorption. But how? I will give you the complete table. But before that, it comes my question. Yes, Arti, you're right. Yeah. So before that, I'll ask you the question. Most of you, in fact, every one of you, would have gone to cinema hall. I have not visited past 5-6 years, even before the COVID, but yeah, I've gone also. I've also gone. All of you would have not gone maybe after COVID, or most of you have not gone. But yeah, all of have seen sometime the cinema hall or the big auditorium. But I'll take an example of cinema hall today when we understand the concept of acoustics. Have you ever noticed where we sit, and in front of us there is a screen where we see the cinema? We don't have, have you seen the wall from where you take entry, entry gate, everything, the complete wall, the big wall? What is the surface quality of those wall? Wooden wall, obsessed sound in movie theater to prevent echo. Okay, I'll come on the echo part. Yeah. Echo, I'm not talking here right now. I'm talking more of acoustics, acoustic impedance. Yes, noise absorber. Kasand, very good. You are going well. Well, okay, I'll not wait much. I'll tell you. If the cinema hall, I was on this. If the cinema hall has plain wall, what will happen? If it has a rough wall, what will happen? Suppose this is a screen. This is where the person is sitting. Okay, this is where the person is sitting. Now suppose I will take the color like a wall. Okay, wall is like this, plain wall. The sound quality, if it is a plain wall, it will go, it may get absorbed a little bit, and it will come directly to you. Okay, and it will create noise. It will be creating, somebody said echo, but not exactly echo all the time. It is a kind of acoustic disturbance. If the wall is rough, somebody told like a curtain or obsessed with wood, and very true, observer. Why? Acoustics, sound will be absorbed. Acoustics will not get interfered. The sound waves will not be interfered. Okay, interference of wave is a big chapter. You can understand, you can actually learn from the Google and YouTube as well. Interference of sound wave creates, and then you will not have a problem. You will be able to exactly hear what movie is going on about. Okay, so cinema hall walls or auditorium walls are never plain. Either it's with absorber or with the zigzag kind of manner, either curtain or little bit of, it will never be plain wall. You will see that. Okay, now as we talk more of absorption, acoustic impedances, everything like absorbing capacity, acoustic impedances tables are important to be clear here. Now, this is what is important for us. So come back to our own chapter, from physics to biophysics to ultrasound of electrotherapy. So here you can see blood. I have taken, first I'll list those things: fat, nerve, muscle, blood vessels, skin, tendon, cartilage, bone. So what are you seeing? More of liquidate structure. We are moving toward comparatively harder structure. More of soft liquid structure like blood. We are moving toward the harder structure like bone. Okay. Here I have selected two kind of ultrasound. You can, because it is important to understand. So in a single table, we'll finish the impedance game. Here you can see 1 megahertz. Only one you take example, that will come later. Okay, 1 megahertz has 0.028. Okay, but when you come to the bone, it is 3.22. Okay, so this says about impedance. This says about what? Impedance. So, so it is always a tissue specific, and more absorption happens with the more collagen content tissue. Okay, and then of course it depends upon the frequency also. So when it is a 3 megahertz, you have to just multiply it by 3. The same coefficient you have to multiply by the 3. You will get the answer. Okay, next part is important. Another feature called scattering. When it is a scattering, it was a very famous question in our school time in physics, scattering. Okay, scattering in light is a very famous question. Scattering in sound also happens. So generally you'll see general physical forces where some form of radiation like a light, sound, forced to deviate from a straight trajectory by one or more points. So when you drive in any of the metro cities, including Bangalore, in night time, you will see the sky red. Why sky is red? We all have red. Sky is blue. In night time, why it is red? Because of the street lights. What you are able to see only is the light. That looks little reddish. Clear? Now, if you see the sky normally, how it looks? Blue. Reason behind? Any one of you? Wavelength region, right? Wavelength region. Somebody is asking, it will take time. Someone asked me personally message like how long our meeting will continue. I can finish in another half an hour, but when it comes to physics, mathematics, and relating the physics, mathematics to our physical therapy practice, I really don't see the time. Time is almost half the time is past. Another half time, like before 2 o'clock, we have to finish it. Before 1:30, 2 o'clock. Well, so what happened? This can be due to the localized non-uniformities in the medium through which they pass. This is really a deeper physics, but in that you can understand. As we said earlier, like energy can never be destroyed, not be created. It can be changed, always the form. But there is one more point. Entropy is increasing in the universe. Entropy is what? It's a randomness. We'll not get into much detail. Otherwise, again, it will take more time. So scattering, you understood. Next is the attenuation. These all are the properties of waves. Okay, attenuation, very, very important for ultrasound. Attenuation is a result of absorption, reflection, and refraction. Absorption accounts for 1/2 of attenuation. Okay, attenuation coefficients are tissue and frequency specific, higher for the tissues with high collagen content and increases in proportion with the frequency. What we saw the table just before that. So 3% only in the blood, but when it comes to the bone, 96% attenuated. So we say, no, in many of the foreigner book, you see foreign writer book, they'll be talking about the ultrasound head, how much attenuated, right? In that, if you read, you'll find really good words. I love that word, attenuated. So attenuation is nothing. You should remember, it's a, you don't get confused with the word attenuation, especially the new physios who have joined here today, me from YouTube as well as from normal Zoom, like your bundle category. In that, whoever has joined, don't get confused with the word called attenuation or attenuated. It's just a result of, it's a summation effect of absorption, reflection, and refraction. ठीक है, पता चला आपको? एब्जॉर्प्शन है, रिफ्लेक्शन है, रिफ्रैक्शन है, इन सब का जो एक समेशन है उसको हम बोलते हैं एटेन्युएशन. सो आप अगली बार से कहीं भी ये देखें, इट इज एटेन्युएटेड, डोंट गेट कंफ्यूज. ठीक है, एटेन्युएशन जो होता है, आप ये मान के चलिए, एब्जॉर्प्शन इज ऑलमोस्ट हाफ ऑफ द एटेन्युएशन, और एटेन्युएशन का जो कोएफिशिएंट है, उसका जो एक मार्क है, कोएफिशिएंट कांस्टेंट, वो टिश्यू और फ्रीक्वेंसी स्पेसिफिक है. ज्यादा वही होगा जहां हाई कोलेजन कंटेंट होंगे. तो हार्डर द टिश्यू, यू हैव मोर एटेन्युएशन, लेस द कंटेंट ऑफ कोलेजन, लेस एटेन्युएशन. सो ब्लड इज जस्ट 3%, बट एज बोन इज एज हाई एज 96%. हालांकि एक टेबल है, you have to see the table, blood, fat, muscle, skin, tendon, cartilage, bone. अब आप पूछेंगे ये क्यों जरूरत है, आने वाले टाइम में आपको पता चल जाएगा. अगले 20 से 25 मिनट में you will come to know how it is important, why it is important, and why the attenuation plays very, very important role when we select, when we see the many questions. Now biophysics we will continue. अच्छा, यहाँ पे there I have taken one kind of flow diagram for you. You can see there is a grading circuit, always important. Then of course you have a power supply. Power supply usually either from your DC source or AC source. AC source is more common in India. Most of the machines work on AC ultrasound machine. And then इसके बाद क्या है, आपको it will go to the 1 megahertz or 3 megahertz machine. Then it will be a sine wave generator and amplifier. Then this will go to the crystal. Crystal plays very, very important role. Crystal is something, what is that crystal? कॉइन के जैसा देखा होगा आप लोगों में से कितने लोगों ने देखा होगा, जैसा पीजो इलेक्ट्रिक क्रिस्टल. पीजो इलेक्ट्रिक क्रिस्टल पे बात करता हूं, 2 मिनट वेट कीजिए. फ्रीक्वेंसी इज यूजुअली व्हाट वी सेलेक्ट द फ्रीक्वेंसी इज 1 to 3, 1 or 3 megahertz. Both frequencies have different features. We'll be talking about what is the beauty of 1, what is the beauty of 3 megahertz. Few of you are using 1, most of us we are using 3, right? So wavelength 1.5 mm for 1 megahertz, 0.5 mm for 3 megahertz. Now don't get confused. There is a formula called V is equal to N lambda, where V is the velocity of wave, and it works for any kind of wave. Okay, N is what? Frequency. Lambda is what? Wavelength. So this is very sure. Velocity तो आपका सेम ही रहेगा ना साउंड का. सपोज आपकी वेलोसिटी इन यू आर डूइंग अ कपलिंग मीडियम एंड देन इट इज 1500 मीटर पर सेकेंड. वाटर के अंदर आप अल्ट्रासाउंड कर रहे हैं, सो दिस इज 1500 मीटर पर सेकेंड. नाउ व्हाट हैपेन, योर फ्रीक्वेंसी, यू हैव सेलेक्टेड 1 मेगाहर्ट्ज मशीन. ओके, लैम्डा वैल्यू इज व्हाटएवर, लाइक सपोज 1500 है, लैम्डा 1500 मीटर है, ठीक है ना. नाउ व्हाट हैपेन, and frequency 1 mega 1 to 1 per second वाला बात होगा, because we have selected 1. Yeah, so now if you take 3 megahertz machine, frequency you have increased for 3, wavelength will automatically divided by 3, because why? Now n की जगह if you are increasing 3 times n, then lambda you have to divide by 3, so that it will be cutting and it will give you again the value of n lambda, which is exact V. So real calculation of velocity, I mean the real velocity will remain same always. To keep the velocity same, you have to select frequency of the machine. According to that, wavelength will change. Okay, so this is not a big problem. You can understand that. Production circuit I have shown you. There is a grating circuit, power supply to that, and 1 megahertz or 3 megahertz sine wave generator and amplifier is there, which is producing the current, and it goes to the piezoelectric crystal where it produces the ultrasound. Now, why did I keep the piezoelectric crystal completely separate from the what we are doing right now, from the grating circuit picture, sorry. Piezoelectric crystal में क्या होता है ना, you have a ultrasound head. I'm not in clinic today, otherwise I could have explained you that way also. Ultrasound head होता है, all of you are using, so all of you are knowing it. इफेक्टिव रेडिएशन एरिया, कोई भी मशीन बेचने आए आपके पास, आप उनसे पूछिए व्हाट इज योर ERA, व्हाट इज इफेक्टिव रेडिएशन एरिया? Area of the sound head that produces ultrasonic waves. Okay, so transducer ka head, it is so big, right? It is a bigger one, but ERA cannot be so big. It is expressed in square centimeters, of course, the circle hai na, the square centimeters, but it always lesser than the actual head size. Okay, so larger the head diameter heads, column beam. Smaller the diameter head, more divergent beam. I'll tell you how it happens. Don't be confused with that. In next slide will be, next 2-3 slides will be knowing the physics and mathematics of that. Very, very important. Low frequency like 1 megahertz is diverse than 3 megahertz. Why it is happening, we'll let you know. Now, ERA, what I said you, effective radiation area. So this is your piezoelectric crystal area which produces the ultrasound effect. Okay, if ERA is good, your beam is column, means the sound wave will be coming like this. It will be, say for example, it will be like this. No, I should say you like this. Okay, if it is a like a small diameter, it will be divergent like this. How it happens, we'll see in the next slide, next to next slide. Beam non-uniformity ratio, this is after the ERA, effective radiation area. This is very important. Beam non-uniformity ratio, BNU ratio. BNU ratio also there is a, you should check when you purchase the machine. Okay, you have a two type of intensity here. Two type, I mean to say two ways to look at it. One is a spatial peak intensity, the peak intensity of ultrasound output over the area of the transducer. This is the area of the transducer where spatial peak intensity is coming here, here, where. Spatial average intensity. Average intensity is what? Average of the complete intensity coming out of this ultrasound head. It is an average of bigger, lesser, anything. So what is beam non-uniformity ratio? It is a ratio of highest peak, spatial peak intensity to the spatial एवरेज इंटेंसिटी. समझ गए मेरी बात? ये आपका ट्रांसड्यूसर का हेड है. कुछ ऐसे पॉइंट होते हैं स्पेशली इन द मिडल वेयर यू हैव द हाईएस्ट इंटेंसिटी कमिंग आउट, दैट वी से एज स्पेशियल इंटेंसिटी, स्पेशियल पीक इंटेंसिटी. देन यू हैव, हर तरफ से तो आ ही रहा है, वेव्स तो आ रहे हैं, तो देयर इज एवरेज आल्सो, स्पेशियल एवरेज इंटेंसिटी. Okay, if you divide both of that, spatial peak intensity divided by spatial average intensity, this gives you beam non-uniformity ratio. Okay, if you have smaller BNU, that means spatial peak intensity कम रहेगा एवरेज इंटेंसिटी से, ठीक है, कम रहेगा, like I mean to say spatial peak intensity divided by spatial average intensity, SAI, I should write it. Okay, if this ratio is less means less than 5 or maybe equal to 5, then it is supposed to be the good ultrasound head. Why? Because it is actually doing what? It is not diverging. It is actually clearly more uniform wave is coming. This is very true that in your ultrasound head, there is a transducer where the peak intensity will be 1 or 2 point will be more peak intensity, but other points will be on an average. So what we do, more peak divided by the average, we take out that ratio. If that ratio is less than 5, that means beam is going more uniform. Otherwise, what is happening? One point is going more, another points are going less, and it will be more ununiform, like a non-uniform ultrasound activity, and this will work bad for you. I mean, it will not be, machine will not be good. So you should ask all these things when you purchase the machine. BNU ratio I have shown in the picture. You can see this. This is how intensity works in the transducer. This is the transducer head. I'm talking about this particular transducer head. All of you are able to see that. here you have kept a gel, but this is not gel, huh? Don't consider this gel. This is a pictorial presentation of sound wave, where you can see sound wave is as good as certain point like this and coming like this. So there is an average of to the least wave it is going to generate, and to the highest wave it's going to generate. It's a summation, it's an average. Suppose it comes on this level. Okay, now highest was at this level. So you divided spatial peak intensity divided by spatial average intensity. You got the ratio of 5 or less than 5. Your machine is good. Suppose this ratio is 10. That means what? This particular thing will go here and come. Is it good for the patient? No, it is bad for the patient because your machine is not working properly. Hope every one of you understand. Hope every one of you understand. Please say me in the chat. If you have any issues, you can just let me know. Okay. So this is really very, very important concept. Once you understand, you don't have to ask me. I told you in my initial minutes of discussion, don't ask me which brand. I don't endorse, or anyone from my Rehab Academy will never endorse any brand. For today's class also, there was a good offer of promotion, but we did not choose it because we don't want to get into that. I want to tell you the concept, not the company. Good. You can always send me message in the chat here only. Somebody asking about the SD curve. Don't worry. Today SD curve concept will be clean. I know one second year student, he's asking me, don't ask, you can ask in the chat only, don't send me the personal message. He's asking about, sir, chronic say Rio base, samajh mein nahi aata hai, like how to differentiate in the examination. In the examination, I'm really sorry. In the examination, they ask about Rio base, how to differentiate and how to make it. So don't worry, your concept will be clear today. I repeat it, your concept will be clear today. The moment you leave the class, you'll be in the confidence stage and you'll be able to answer that. Don't worry. Let us study what we are studying right now first. So types of beams, very important. All of us know about it. One is a continuous beam and one is a pulse beams. You have seen, no? Like you have in the knob only, you will have either, they'll be asking you the continuous or pulsed. What is the use of continuous? What is the use of pulse? We will be seeing that. Continuous, it will be like a no interruption. It will be complete. Once you have set the frequency, it will maintain the frequency. But here pulsed, suppose this is the intensity in this level and this is the time on the x-axis. If you see the intensity, the continuous will be same throughout. But when it comes to the intensity and time here, pulse will come and then it will go for rest. Again, it will come, again it will be rest. You have a different pulse selection. In fact, you have a 1:1, 1:1, if I'm not wrong, 1:4, 1:8. Even 1:16 is there. Right? It is there in the machine, right? It is there in the machine, right? Yeah. So what is that? 1:1. 1:1 means one pulse has come, and after that it has rested. Okay, again one pulse came, rested, one pulse came, rested. Cool. Now what is 1:4? One pulse has come, it has rested for 4 part, and then again 1 second has come and then rested, like that. Okay, where we are using, okay, we'll be letting you know. Yes sir, but how it check? How it check? Okay, your company person will tell you about this. Now one more concept is there, spatial average, like a temporal peak intensity. SATP concept is also there. SATP concept is just try to understand what is the word called spatial average temporal peak intensity. So it is a average intensity of the ultrasound on time pulse. Okay, average intensity, which is getting maintained. Suppose you select the intensity, right? 0.7, 1.2, 1.4. How many of you select more than 2.4, 2.5? Please be honest. No problem. There is no problem. Please tell me who is selecting 2.4, 2.5, 3, 3.2, 3.4. Who is selecting? Please answer in the message. None of you select 2.4, 2.5. No. I'm not COSA. COSA. I'm not asking 1:1. 1:1 is a pulse. I'm talking about 1.1 you are saying. Okay, good. Okay. No. I'm talking about who is selecting more than 2.5. My question is very simple. Yeah. Nobody? No problem. No. Okay. No, max is 2. No. In few machines, that is 3.5 also. Okay, anyway, if you are not selecting that, you are doing justice to your patient anyway. Now, spatial average intensity of the ultrasound, if you see, because it considered even the off time, means when the pulse is not present. So normally it is spatial average temporal peak intensity. If you consider the duty cycle, if you calculate with the duty cycle, it will give you spatial average temporal intensity. Okay, so this is the normal thing. Now this is also very important. Somebody asked like what is like how to check it. This also you can check it if you are not able to, your marketing person is not able to answer that what is BNU. Nice. So what is the BNU? Then you can ask what is about near field and what is far field. That you can answer. How will you check? I will let you know. Don't worry. This you can actually check by yourself. This is ultrasound transducer. You can see that, right? So after that, from here, the wave started coming to the human body. For certain structure, for certain distance, it will be near field. And after that, it will be far field. Far field is always divergent, means it will go away. Near field will be almost uniform. Now you will say me, sir ने कहा check कर सकते हैं. कैसे करेंगे? NFL means the near field length is equal to A square by lambda. A square is what? A is what? A is the radius of transducer. Radius. Okay. If you multiply by 2, it become a diameter. Okay. Diameter of transducer. तो आपको क्या करना है, उसका रेडियस निकालिए ट्रांसड्यूसर का. सपोज दिस इज 2 इंच. 2 इंच तो नहीं होता, 1 इंच. इसका रेडियस हो गया कितना? 0.5. सो 0.5 इंच को यू हैव टू कन्वर्ट इनटू मीटर. देयर आर मेथड्स, प्लीज गो इनटू दैट, कन्वर्ट इट. सपोज इट कैम 1.0 मीटर. सॉरी 1.0 कभी नहीं आएगा, 0.01 आया मीटर के SI स्केल पे, because lambda has to be selected in the meter. Okay, and after that you have to choose the wavelength. Suppose I have taken the 1500, say for example nanometer. Okay, so if you do this mathematics, NFL will come. Near field. Near field is something called Fresnel zone. Fresnel zone. It is convergent, means either it will continuously in a same feature, like a same manner it will continue. See here, it will be like this, and after that any wave is supposed to be spread. That we say as a Fraunhofer zone, the divergent region. In space also we see Fresnel zone, Fraunhofer zone. Okay, so NFL is what? Square of radius of transducer divided by wavelength. If you calculate this, you can actually calculate how deep and how nicely your ultrasound wave is getting inside. Actually, anyway, this is easy. Now, acoustic impedance, as I told you earlier, also I have given you the table. It's a measure of resistance. What is that impedance? Impedance is nothing. You should understand impedance is all about resistance, nothing else. It's nothing. It's just a resistance. Resistance of what? It's a resistance of particles of medium to the mechanical vibrations. Mechanical vibrations. Okay. And because when you use the ultrasound head, क्या होता है आप बॉडी के लिए यूज करते हैं, क्या होता है, it actually provides some resistance, right? एंड इस रेसिस्टेंस में ही क्या होता है, वाइब्रेशंस होते हैं. वाइब्रेशंस तो मानते हो ना, होता है, क्योंकि ये साउंड वेव है. इट विल क्रिएट वाइब्रेशन, कंप्रेशन, रेफ्लेक्शन, वाइब्रेशंस, राइट? तो ये वाइब्रेशन होता है. डिफरेंट टिश्यूज में डिफरेंट वाइब्रेशन होता है, दैट वी विल टॉक नाउ. बट और कभी भी डेंसिटी ज्यादा रहा तो वाइब्रेशन विल बी मोर एटेन्यूएटेड, राइट? है ना? So it is very very important to see the which kind of medium you are using and what is the velocity of ultrasound. Of course you have to select the particular type of ultrasound. इसके बाद there is something called standing wave का concept है. Standing wave का concept is also fairly important. So whenever you have a reflected ultrasound meets another upcoming wave, a standing wave, that we say as a hotspot may be created, which has a potential adverse effect upon tissues at local, very very minor level. It effect can be minimized by ensuring that apparatus should have a uniform wave. You select the good machine like BUN uniformity ratio, as I was telling you earlier. And then of course you have using pulse wave or moving the transducer all the time. ठीक है? अल्ट्रासाउंड का जो ट्रांसड्यूसर है आप उसको मूव करते हैं. यू नेवर कीप इट स्टेबल, राइट? यू नेवर कीप इट स्टेबल. डू यू? We never keep it stable, right? We keep mobilizing, we keep moving. How to move? Small circles and concentric circles. Small, slow, concentric circles. Clear? बड़ा तेजी से जल्दी जल्दी करने का कोई वैल्यू नहीं है, because one time it is going to the body, another time it is getting exposed to the air and getting figure of 8 is also good. Figure of 8 is also very popular, no problem. Will there be dispersion? Okay, well, dispersion is a different concept. Will not talk much because at such local level dispersion is not much possible. Well, and then this is the only reason that to create no hotspot, to avoid making of hotspot, we keep moving our machine. Do you know we don't keep transducers in air like this? You know why? It can hurt machine. Let me see. Okay, it is harmful or it is not harmful, we are coming on that, Amitji, but generally we don't. I'll tell you why little later. So moving the transducer during the treatment, safeguard your machine, safeguard your transducer, because in ultrasound it is not a good medium. It's not a good medium, correct? It's not a good medium. Because why it is not a good medium? It actually passes very slow. Air causes cavitation. Wonderful. Air causes cavitation. That also we will see in our upcoming slides and upcoming discussion. Cavitation. Very nice. So more of it doesn't pass so well, right? So we need a coupling medium. Anyway, we are coming to the next concept of impedance is over, I believe. Now next concept is half value depth. Yeah, half value depth is something very very important for all of you. Kindly understand what is half value depth. I told you today before starting ultrasound, we will get very deep into ultrasound. What I am giving you today, it is not a one-day class. In our class, ultrasound is a 3 days class. So it takes time to understand all the concept. And of course, most of the students, they join. So I need to give more time to make them understand. High value depth. This is a tissue depth at which 50% of ultrasound is delivered at surface has been absorbed. Suppose you are using an intensity of 1.2. Okay. And this is the skin and you are using wave is coming inside. Wave is coming inside like this. Wave is coming inside. But you know, at certain distance, this intensity will reduce to 0.6 because it is countering the medium. It is getting passed through the medium. Where it exactly goes half, we say that half value depth. Okay, half value depth for 3 megahertz machine is 2.5 and 1 megahertz machine is 4 centimeter. Now let me tell you one thing. All of us mostly use the 3 megahertz machine since very very long time. That is only going on 3 megahertz machine. If you are using 3 megahertz machine for your trapezius muscle, will it work or will it not work? Yes or no? Give me the answer. Those who ask me about whether we can use the intensity, answer lies here actually. Can we use for trapezius pain 3 megahertz machine? Yes, of course we can use. इतना क्यों सोच रहे हैं आप लोग? बिल्कुल सही है. We can use it because trapezius muscle will. Yes, Vijay Krishna ji. So why? Because trapezius muscle within 2.5 centimeter में आ जाएगा. So ultrasound will actually work. And when it comes to the last, it actually works. So trapezius muscle, it will cover, will do good effect, really good. Liked it, Pramod ji. So next is, can we use the same machine, 3 megahertz machine, for frozen shoulder? Any one of you? We can of course use, but will it work to the core of our satisfaction? I'll check. No. Right, Hubes? Real me. Sorry, I don't think it's your name, but anyway. No, it will not work. Why? Because the structure is a bit deeper. So आज से आप लोग क्या करोगे? You have to ask your person whenever you are purchasing machine, किसके लिए use करना है सर? कितना megahertz का है? No, and then you don't have the surface is different. No, it's not just surface is different. Something that the area where we need to get the effect is bit deeper. Capsule is bit deeper. So if it is bit deeper, 2.5 may not suffice. As I told you, after going to the distance of say for example 2 centimeter, just 2 centimeter, what will happen? Sorry, just going to the distance of 1 to 1.5 centimeter only, what will happen? Half value पे आ जाएगा ये, तो आपका तो काम ही नहीं बनेगा, है ना? And the moment it goes to 2.5, 2.5, 3 megahertz machine, your intensity is 0. ये जो intensity आ रहा था from transducer, it is coming here only, right? So if it is a trapezius muscle coming into this range, it will work. If your shoulder, like joint capsule comes here, which is at depth of almost 3 to 4 centimeter, how the ultrasound effect will reach here? It will not reach. So it's a time wastage for you and patient as well. Now you understood my point. So always remember half value depth. Half value depth का अगर आपको ज्ञान रहेगा, if you have a knowledge of half value depth, I'm telling you, आपको धोखा नहीं होगा. You'll be able to understand where to use what. Okay, well, now muscles के लिए 1 megahertz 9 mm, but 3 megahertz it will go hardly up to 3 mm in general, right? So fat के लिए 50 mm 16.5 mm. When it comes to tendon, 6.2 mm 2.0 mm. These all tables are available. I don't know in Google, but it is available in good book of electrotherapy. I don't know which book are you following for electrotherapy, but in my fair suggestion, you can always, of course, you can see the skeleton. And then the book which I followed in my second year was more of Low and Read book. I think Electrotherapy Explained or something. This book is really good. It gives you a lot of insights for new research. So all of you can refer for various topics. It really gives you wonderful insights for new research. It doesn't tell you always that this is what you should do. It makes you to think, why should you do? So this is something you like about the book. Okay, and there are many good books nowadays. I feel it's Cameron. I am not sure about it. I never read about it. So which I read, I just told you. My personal experience with Low and Read has been always good. And then those days I used to get CD with the book. So that is also is very comfortable thing. So nowadays, I don't know which edition it is. This I'm talking about some 15 years, 16 years before the story, when I was in my second year of physical therapy. So typical half value, of course, it depends upon the different tissues. As I said, you can get into the good number of books, this kind of table. This is good for academics, but to understand clinical way, now you should recite at least itna yaad rakhenge na aap. Just if you remember this much only, no, this works for most of the time. I'll tell you, itna hi yaad rakhiye aap. 3 megahertz का क्या डेप्थ है, 1 megahertz का कितना डेप्थ हो सकता है इन जनरल एवरेज में, इतना ही ध्यान रखिए आप. You will be able to crack most of the cases where and which intensity you should use. If you are using more intensity, that means what? 50% डेप्थ पे जाकर के उतना इंटेंसिटी यू आर एबल टू यूज. समबडी आस्क्ड मी वेदर वी कैन यूज मोर देन 2. It is harmful. Look, Baba, it is not harmful if we are using the, should I tell, or after some time? After some time. After some time, we are coming on that. So everyone's answer will be there. Well, so again, thickness and then average body built up and average half value, all it depends upon the body type also. So let's have certain activities. Someone again asked me the message. About the class. Okay, well, so क्या है इसमें, अभी हम क्या बात कर रहे थे. Let's do certain activities. How to have orientation. आपको सबको अच्छे से पता है, अल्ट्रासाउंड मशीन लेना है, and then you have to check what? You have to check manufacturer. Don't ask me. Last inspection date, manufacturer date. Okay, very, very important thing, because see what happened. If you are purchasing a biscuit, you always see what is the expiry date, right? If you are purchasing anything, you have expiry date, which is to eat or to have any kind of drugs or anything, including our gel also. I think there is an expiry date of good quality. Anyway, now even the spirometer, I have seen the expiry date they are putting. It's wonderful practice. But in machine, what happened? No, it doesn't get old very soon. So even the old models can be available. So you should always ask about the manufacture date. Always go with the latest one, as much as your finance permits, and then available frequencies, whether it's a 1 or it's a 3 megahertz machine. I would always prefer that if you have a single unit, at least one unit in your clinic, you should keep the 1 megahertz also. ठीक है ना? Available transducer size तो इतना बड़ा दिख रहा है ट्रांसड्यूसर का. I have seen certain, I'll not take the name of course, but some companies ये बड़ा ट्रांसड्यूसर, but आपको क्या फायदा उससे? You have to check what? You have to check ERA, effective radiation area. ट्रांसड्यूसर ऊपर से दिखने में बहुत बड़ा है और अंदर देखा तो इतना सा एक पुराना 25 पैसे वाला कॉइन जैसा पीजो इलेक्ट्रिक क्रिस्टल है. कितना निकलेगा उससे? So ERA is very less. आपको तो इससे मतलब है ना, ERA, effective radiation area, which we discussed some time back. Okay, so ERA is something very, very important. So ERA को ध्यान रखिए और ट्रांसड्यूसर के साइज पे मत जाइए. I have seen a lot of gimmicks in that. Okay, effective radiation areas को देख लेना आपको, which I told you just now. Then you have to see available duty cycles. Do you have a duty cycle in that, or you have a just kind of, there are certain, I was gifted by one senior nurse that one ultrasound, which is very handheld and it's beautiful, no doubt, but you don't have a duty cycle well explained over there. So 5 minutes of cycle is there, and then you have a pulsed set, either you can have a continuous or pulsed only 1:4 or something like that. So those kind of machines you should not keep. I got as a gift, that's a different thing, but you should keep. It's good for some portable stuff, but I would say that it's not very helpful for long run. Okay, it looks very fashionable, it looks very lucrative, but yeah, when it comes to the real treatment, it may not serve your purpose. Simple. Then you should see the beam non-uniformity ratio. Ask your dealer, like iska beam kaise hai bhaiya, like near field mein kaisa hai, far field mein kya hai, divergent hai, kam hai, kaisa hai. You should, and then you should always locate 2 different components and inspect them. What is that? Generator, coaxial cable, because cable is very, very important. Now don't ask me whether it's a 2-wire cable. उसका केवल आप देखोगे ना अल्ट्रासाउंड का, there is a 3 wire. Okay, there is a 3 wire. आपने देखा होगा बहुतों ने. और there are few cables, I have not seen much, that is with the 2 wires also. It is okay to have 2 or 3, there is no problem, but you should check that properly whether that is fitting or not. Then you should always check with the transducer, because I always believe that ultrasound में अगर सबसे important part है तो it is the head transducer. Okay, उसके बाद timer, whether it's working properly or not, you should match with your clock, and then you should you should match with your clock, office clock, or you should match with your wristwatch, and then you should do it. Then you have a timer. Timer should, whether it's working or not properly, as I told you, is very important. Intensity control, whether it's getting well knobbed or not, because suppose sometimes what happens, you are taking the knob so high, but intensity is just showing 1.5. So that also you see. Few machines, good machines, I can tell you, good companies and all, they are making with the LED light. So what happened here, now you will see it's a fancy. No, I would not consider that fancy. It is not fancy. Let me tell you. what I believe, why they consider, because see, few of the factories, few of the well-known company factory in India, I have gone. I was privileged to have a look how they make SWD, how they make everything. So I have gone there. So it's really good to see. Sometimes you should take time out and go. So क्या होता है ना, जब आप इसकी इंटेंसिटी बढ़ाते हो 0 to 1.5 or 2.5 or whatever, so light also grows here. I mean, you see the LED, more lights start lighting here. So इससे क्या फायदा है? इससे ये फायदा है, suppose your intensity is not working, okay, your light only will not move up, no matter how much you are moving your knob, whether because of mechanical breakage or whatever be the reason, your knob only will not, your knob is moving but light is not going up. That means the intensity is a trouble. If sometimes light is going up and knob is not moving, of course physical damage. Yes, you are right, Aarti. You will have more insights when you are progressing ahead in this class. Another 10 minutes of ultrasound, 10 to 15 minutes, and after that you'll be switching to the electrical current. That will be also a longer one, but I'll try to cut short, and then I'll give you certain insights for SD governor. Don't worry. We'll have a 2 minutes of break, then we'll start. Now, duty cycle control, always check that whether duty cycle control is working. Now, testing method is very, very important. I don't know, all of you must be testing the ultrasound with the method 1, where we are using the, transducer ka head le lete hain, and after that we are putting a drops of water here, and then when we start the intensity, drops start vibrating. That's the wonderful test. Okay, sorry, the method 2, most of us we are testing, adding water drops on top of transducer, but underwater test bhi hai, ripple method hai, aap wo bhi karke dekh sakte hain. It's good to check that method also. Testing kaise karna hai, that I think most of you know, like keeping the ultrasound head in a beaker of water, and then when your intensity are putting it, it actually creates certain ripples, right? So that you have to see. Now, coming to the effects, most of the ultrasounds are coming nowadays with both the effects, the thermal and non-thermal. Okay, thermal, as some of you rightly said, that more the intensity, you use the thermal effect, of course, but in that case, it should be continuous mode. It should not be in pulsed mode. Okay, continuous mode में रहेगा तो heating effect ज़्यादा आएगा. अभी thermal effects are for what? Increase extensibility of collagen fibers found in the tendon and joint capsules. Then decrease in the joint stiffness. बहुत important है ये, decrease in joint stiffness. Don't consider it low. Okay, reduction of muscle spasm. You can. Modulation of pain. Yes. Increased blood flow. Of course. Most of the modalities we are writing that. Okay, thermal effects ऐसा है. Non-thermal effects में if you are going, some of you actually discussed about cavitation some time back. So इसमें क्या होता है? Cavitation है, micro streaming है, and then you have acoustic streaming as well. So cavitation में क्या है? It's a formation, growth, pulsation of gas filled bubbles caused by the ultrasound. Should be stable, unstable. Stable जब भी होगा, it will oscillate very rapidly, but don't burst. But unstable वाला जो होता है, it is one of the like bursting nature. Okay, so many cycles excursion agar hua to suddenly implodes hota hai, which causing large local pressure or temperature rise. Okay, so this you should keep in the mind. That's it. Stable or unstable cavitation. Then pressure is below a critical value, the bubble undergoes sustained oscillation, stable type, and if inertial forces are above cavitation, then collapse with the bubble implosion occurs. ठीक है, ज्यादा इंटेंसिटी हुआ तो ऐसा हो सकता है, because already there is a bubble formed with the gas filled bubble. Possible therapeutic benefits की बात अगर करेंगे तो of non-thermal effect के बारे में अगर we are talking about non-thermal effect, again I always say like not much difference, but yes, definitely capillary density, more of blood circulation, cell permeability और increased fibroblastic activity जो है वो नॉन थर्मल इफेक्ट होता है. नॉन थर्मल इफेक्ट यूजुअली कैसे आपको मिलेगा? अगर आप पल्स्ड में जाओगे विथ लेस इंटेंसिटी तो. ठीक है ना? एवरीवन इज क्लियर? लेस इंटेंसिटी एंड इन द पल्स्ड मोड. अभी ऐसा किया तो नॉन थर्मल इफेक्ट यू विल बी एबल टू जनरेट. नाउ आ गया ना क्वेश्चन, इंक्रीज्ड फाइब्रोब्लास्टिक एक्टिविटी मींस द सेकंड फेज, दैट मींस द acute condition. क्लियर? नो? सी यू शुड connect the dot. Proliferative phase में पढ़े थे ना हम लोग, फाइब्रोब्लास्टिक एक्टिविटी. स्टिफनेस को कम करना है, we can go for the continuous mode thermal effect, because stiffness is something which is set, right? So in that case, we need a remodeling, which is actually the chronic condition, remodeling, molding of the tissue. But here, आ गया ना चीज सब acute में pulsed intensity low करके pulsed अगर if we are using, then we are more for the fibroblastic activity. Correct? No? Connect the dot. You will have increased cortisol production at local level around the nerves, bundles, reduces inflammation. This happens like more of cortisol means pain get reduced. Overall, we say that calming and soothing effect. Let us see this particular thing as a picture. Cavitation कैसे बनता है? You all can have a look. O2 H2O पे confuse मत कीजिए. That is a water, and then oxygen molecule, hydroxide molecule as well. Then you have another picture also explaining non-thermal effect. Okay, don't get confused with this picture. I'll explain you this picture, how it actually work. Just 1 minute. It is actually the picture of underwater using ultrasound. This is beautifully we are using for some of the conditions. Okay, acoustic microstreaming. So इसमें क्या होता है ना, unidirectional flow है. You can see unidirectional flow along the cell membrane boundaries. So there is a more viscous stress. Viscous means we say kind of thick stresses. Okay, and it alters the membrane structure and function. So it is supposed to have a change in the permeability. Maybe more permeability happens, the more blood circulation happens. So you will remember now, non-thermal mostly for uses for the acute conditions or subacute conditions where we need proliferative phase means fibroblastic activity, blood circulation increasing. Don't mug up, just try to understand how nice it is. Stiffness ho gaya, chronic condition ho gaya, remodeling we need more of like a with the activity, with the physical activity exercises. That time we'll be using the thermal effect. Now it is clear. Now we'll be coming to the intensity part also. So output parameters bhi aapko check karna chahiye. You should check the output parameters also. Output parameters usually, it is expressed in the watt per centimeter square. Okay, usually you will see that it will be featured there like that. Okay, watt means it's a power divided by the centimeter square means the area. Okay, in that area how much it is coming up. And now output intensity determined 1 megahertz. As I told you, deep 5 centimeter tissues used for the rotator cuff, vastus intermedius, gastrocnemius muscle, etc. एक बात मुझे बताइए आप लोग, अगर hip का condition है and person is coming to you every day for the treatment and he has not hip condition, I would say it's a gluteus medius condition basically. Okay, or gluteus minimus condition where he has pain or you feel there is an inflammation where you need to give ultrasound. You are doing ultrasound past 10 sessions, nothing happening much. In fact, he's getting much better with the exercises and all. So what you can blame? You can blame the machine. You can't blame the machine, of course, but you can blame the selection of your machine. So which machine you would have selected? You would have selected 1 megahertz, which has a deeper effect. समझ गए मेरी बात? So most of the time, like joint issues where we need to check with the capsules and all, we need to have a 1 megahertz output machine. I would repeat, 1 megahertz for deeper, 3 megahertz for ठीक है surface superficial tissue up to 2.5. क्योंकि 2.5 जब हम बोलते हैं ना, तो आप ये समझिए कि almost 2 सेंटीमीटर तक तो उसका इंटेंसिटी ही आधा हो जाता है ना. इंटेंसिटी all get half when it is 2 centimeter. Right? So now you are using for the ligaments, brachialis, patellar tendon. It depends upon the treatment area, output intensity, and therapeutic goals. Vigorous heating agar karna hai, to 1 megahertz for 8 to 10 minutes or 3 megahertz for 3 to 4 minutes. It will give heating effect. Okay, all continuous. Of course, ultrasound cannot pass through the media, so you need a coupling medium. Okay, directly coupling ke liye we are using the like a gel, and theory is like you should have a head movement like 4 centimeter per second. So slow and concentric and small circles you need to move. Small circle is the best. Someone of you told also, I think you told figure of 8. I'll check who told, I don't know, but ultrasound can be given on external origin for pectoralis major pain. Now depends upon what is the reason of the pain. What is the reason of the pain? Most of the pectoral pain, if it is not because of cardiac condition, if it is because of surgical stuff or something like that, or maybe if it is because of we can say lung conditions, so in that most of the time it is good, it is getting relief by the position itself. Now immersion technique very simple. Kya karna hai aapko? You have to take one pot where you have to immerse the limb, keep the transducer 1 centimeter away from the body part, and then you have to start your ultrasound. It will work. So what is the use of this kind of thing? This is your body part inside. Suppose ankle is inside. Okay, here you are giving ultrasound. What is the use of this, doing like this in the water? First of all, if it is an irregular area, you are able to do it. In irregular area, your transducer won't fit, right? So better keep it in. See, these things, less places you will find, but I'm telling you why. Reason behind, you should have more insights. So what you are doing, you are keeping the thumb in the water, and then you are doing ultrasound from far. You don't need to move, because in like you have to move little bit, only little bit you should move, and the ultrasound is passing through that. Okay, no matter the, suppose ankle area is irregular, you are not knowing like how to fit the transducer, you can't be dancing with the transducer, right? So what happened, like waves are coming up and it's going into the particular area of your choice, area under treatment, I should say. Okay, now pad bladder method, you know very well. Commercial pads, self-made pads aate hain aajkal, or otherwise it's always good to go with the gel medium. Okay, so contraindications, if we talk about, a lot of contraindications are there. You should not do acute injuries like 100% duty cycles. You should never use ischemic areas. You should not use. You should never use on the circulation impaired areas like DVT and all, or anesthetic areas. You should not use. You should not use on the carcinogenic, I mean the cancerous tumor, active infections, spinal cord or nervous plexus, metal, actually exposed metal that penetrates the skin, you should not use. Around the eyes, heart, skull, genitals, all these areas too, you should avoid. You should avoid the pacemaker wherever it is there. And then pregnancy, lumbar and pelvic areas, please avoid. Osteoporotic, stress fracture sites and pelvic area of menstruating ladies, please avoid ultrasound. Okay, next, precautions. Well, many people ask me, so I kept it as a separate slide. Here, symptoms may increase after the initial treatments. You would have seen, you have used the ultrasound for the first time. Second day, he can tell you, the patient can tell you, thoda sa zyada ho gaya tha raat mein dard. This can happen. Okay, use caution when applying ultrasound, especially with the laminectomy. Okay, use of ultrasound over metal implants is not contraindicated. I'm telling you, it is not contraindicated. Keep sound wave moving and keep that head much away from the implants. अब आपको पता चल गया ना कितना डेप्थ तक जा सकता है अल्ट्रासाउंड. अब आपको ये भी पता चल जाएगा कितना दूर पे इम्प्लांट है. So it is not contraindicated. Only thing that you should not do directly on the metal. Use cautions when applying ultrasound over the epiphyseal plates of the growing bone. The most important part, it will affect the growing bone. So we say that any sort of ankle injury, fracture or ligament injury for kids, we should not use the ultrasound on epiphyseal plates of the growing bone. The research is there. It can affect the growth of the bone. No, not like that. Over the pectoral, as you are asking me, over the around the around the heart does not mean that always pectoral pen you are supposed to always use that. Okay, around the heart, especially in the case of pacemaker people, I told that. Okay, around the heart, which is the weaker one, okay, which is having the pacemaker, we are not supposed to use there. And pectoral pen has other things to do in those cases. And somebody asked, the spinal cord, it is contraindicated. No. Over spinal cord also it is contraindicated. Where exactly? Suppose there is a laminectomy. Suppose there is scoliotic feature. Okay, there is a fixation, there is a plate, there is a screw. Okay, well, this class will have a last part of electrical current, and after that maybe we'll be able to finish. As I told you that I forget, usually I don't see time when it is physics and electro. Anyway, now let us see Another picture also have shown that how it works. Okay, pathways through. Okay, I think phonophoresis. Somebody asked me phonophoresis. See, phonophoresis has certain theory, all of you know, and I would tell that it is nothing. It is you are just keeping a drug for the target, okay, and you are using ultrasonic to push that drug inside the problem area with the help of transducer head. What is the what is the advantage that many drugs which is person is contraindicated, like they can't take, or because of any reason, you can actually use that. Okay, standard intensity is 1 to 2, standard duration is 5 to 10 minutes, and there are certain drugs, but I don't know in India how much it is permitted, so do it is as per your council permits, but most of the time I think diclofenac you can mix with the gel and then you can use for your local areas. Okay, so dosage of ultrasound, again I have kept a separate slide. No confusion, I am very clear and honest on this part. To use initial symptoms, 0.25 to 0.5 watt per centimeter square centimeter. Don't laugh at me, this is true. For 2 to 3 minutes. Progression of doses is not needed if improvement is seen. If improvement is not seen, kindly progress the dose. If not seen, increase dose up to 0.8 with increase 4 to 5 minutes. This is for the acute conditions. Okay, aggravation is not always bad, as it indicates the tissue repair. As I told you, pulse ratio 1:7 for very very acute, and 1:8 or 1:16 also in sometimes, and 1:1 for less acute, means subacute also you can use it. Cool, very cool. Now chronic always use pulse or continuous, both you can use, but prefer continuous. If it is not giving you benefit, come back to pulse. I always personally use pulsed. Continuous ultrasounds I don't use usually unless I need to go for stiffness. 2 watt per square centimeter or little more than that for warmth. Initially a low dose is given like a 0.8. If it is a continuous one, you can use 0.8 for 4 minutes. Gradual increase in dose if treatment is not effective. To be very clear, I finished this ultrasound with the dose. Particularly this you can consider for your 3 megahertz machine. Now for 1 megahertz machine, depending upon the depth, you can change it. So spinal areas, as I told you, like if there is a fixation, you should not use. For back pain, you're using for the muscle, not for the spine, to be very clear about it. Okay, so we are breaking for 2 minutes, 1:28, 1:30, we are here for therapeutic current. Yes, we are back. So our next discussion is a therapeutic current. I will give the important insights in therapeutic current. And one of the person asked me directly on the WhatsApp, like, sir, tense के बारे में कुछ बताइए, मतलब tense कैसे use करना है. Well, it is very confusing. So to take out the confusion, I will just see that. I will see one or two chat has come. And then we give ultrasound at the knee range. Total knee replacement done before 5 to 8 years and patient has got knee pain. So can we give ultrasound to the joint? Okay. First of all, let me tell you, if it is a TKR and knee pain has come after 5 to 8 years, it is less likely due to arthritis. Very clear. It is due to either muscle pull or some soft tissue injury. I think I'm audible. Yeah. So those who asked me this question should first analyze where they are going to use. If it is not much deeper, use your 3 megahertz machine and do it at very low intensity. There is no metal inside, right? You are talking about PKR, right? So, well, therapeutic currents. See, there is a lot in current, and I think I must have in our actual class. So there are more than hundreds of slides on the currents, but we will not talk such in detail. We'll go very elementary. Electricity, electron, proton, neutron. Okay, electrons keep revolving and proton and neutron remains on the nucleus. That's where the electricity matters. And what is ions? Ion, what we say as an ion, like it is a charged particle, either positive or negative electrical potential. It's a difference between charged particles at higher and lower potential. Electron, fundamental particles, as we spoke. Suppose this is nucleus, the electron is actually revolving around. Okay, it's a negatively charged smaller particle. Electrical current, net movement of electrons along a conducting medium, but this is incomplete definition actually. Okay, current means it should be under some potential. Ampere is nothing, it's a measuring rate of electrical current. Usually we say as A or MA, milliampere or ampere. Coulomb is nothing, it's a number of electrons flowing in a current. Okay, there is a Coulomb law also. Volt, electromotive force that must be applied to produce a movement of electron. I told you, no, this current definition is getting complete only and only when it is with the voltage. Volt is required. Voltage, the force resulting from the accumulation of electrons at one point in electrical circuit, usually corresponding to a deficit of electrons at another point in the circuit. Suppose here there is a 5 volt and then electricity started flowing because here toward what? Toward 0 volt. Okay, that's the reason most of the earthing is there, right? What we consider as negative or 0. So that's where from positive, from electrical grid, it comes everywhere in factories, in our house, everywhere, and at last it goes to the earth. Well, very basic concept, not get into much detail. Conductance. Conductance is a property of conductor. What happened? Conductance is what? It actually takes the current flows in a very normal ease. Conductor is something which permits the free movement of electrons. Insulators, which resist the current flow. Resistance or electrical impedance, again it is back, opposition of electron flow in the conducting material like your wood, plastic. Ohm, measurement of resistance. Okay, ohm, this is the symbol of ohm. Ohm's law, every one of us know, current in the electrical circuit is directly proportional to the voltage, inversely proportional to the resistance. So if resistance is more woody, current will not pass. Keep it iron, current will easily pass. So what is the formula? V is equal to IR. Okay, voltage is equal to current into resistance. Okay, and there is a watt, measure of electrical power. Power is equal to voltage into current. This is also important formula. So electrotherapeutic devices, what we are going to see, it actually have 3 types of current that produces the biological tissue that are capable of giving currents. Like first is the monophagic or direct current. Okay, we say as galvanic also, uninterrupted and unidirectional flow of electrons. Biphasic, alternating current, you can see this is the alternating current, this is the direct one what we are talking. Then there is a pulsatile, usually contain 3 or more pulses in a group, and maybe unidirectional or bidirectional. These group of pulses are interrupted by short periods of time. Pulsatile current is one of the most important current what we are going to use in our electrical therapy, what we are usually use, not going to use, we are usually using. Now if you see as per the image, those who are from the second year, very important this, and for others for revision, direct current, this is how direct current work. Suppose this is the intensity, ये वाला y axis है ना, ये intensity के लिए है, और x axis जो है वो हम timing के लिए रखते हैं. So y axis पे you can see plus 5 milliampere. This is continuous. Okay, so this we say as a direct current, DC. Usually our batteries are for direct current. Then you have a monophasic pulsed. Monophasic pulsed, that means monophasic pulse current is something that it is a pulsed, means for a second it is there, again it is not there, 0, again it is there, again it is not there. It's like a pulsed, but it is in single phase, it is not coming in double phase. Now there's a concept of alternating current. It is going like this, sine current kind of. Why? 5 milliampere अगर positive में जाएगा तो 5 milliampere it will come in the negative as well. Okay, दोनों तरफ जाना है, पॉजिटिव में भी जाना है और नेगेटिव में भी जाना है. सो नेट चार्ज इज व्हाट? 0. हियर asymmetrical biphasic, 5 milliampere positive, 3 milliampere negative, again 5 milliampere positive, 3 milliampere negative. Just example. Okay, so net charge comes 5 minus 3, 5 minus 2, 3, sorry 2 negative था. अभी balanced biphasic, जितना ऊपर +5 उतना ही नीचे. Okay, again there is a 0, again there is start. For a second it is going +5, again going -5. Okay, second phase में और फिर 0, like that. So it's a biphasic. So सुनते ना कभी like biphasic, monophasic. So this is important to understand the basic. So for a machine it is always used to have a like a electrode which actually provide the coupling medium, and then you have a like a conducting medium. Conducting medium is something which gives the, suppose ऐसे भी इलेक्ट्रोड होता है, इसको आप कार्बन इलेक्ट्रोड है या वैक्यूम इलेक्ट्रोड है, व्हाटएवर, कार्बन इलेक्ट्रोड, और पहले तो मेटल इलेक्ट्रोड होते थे वेयर वी आर यूजिंग द cotton cloth, cotton lint cloth or cotton with the water. Okay, as a medium, right? Conducting medium. So you need to use that electrode for human body. Now transcutaneous electrical nerve stimulus, it is just to stimulate the peripheral nerves, as the name is indicating, transcutaneous, below the skin. Okay, neuromuscular electrical stimulator, what we are seeing, electrical muscle stimulator also, it is for the muscles. Microelectrical nerve stimulator, it is for the tissue healing. Okay, and because itna iska intensity is too small to excite peripheral nerves, it is only for the tissue healing, and somewhat pain also reduces because the tissue get healed. Now low intensity stimulator is also, there is a category. Okay, and after that micro current, again low intensity stimulator को हम लोग micro current भी बोलते हैं. अगर हम like if we take a kind of properties, okay, properties of electrophysiological machines like electrical stimulators and other. So frequency is what? Number of cycles per second. You know, waveforms, the term waveform very important, which indicates the graphical representation अभी थोड़ी देर पहले देखा ना आपने, of the space, direction, amplitude, direction, pulse, frequency of electrical current. The electrotherapeutic devices produces displayed by oscilloscope. Pulse, what is pulse? An individual waveform. ऐसे उठा ना ये pulse. This is what we say as a pulse. Okay. Phase, a pulse may contain one or more phase. अगर ये ऐसे ही चल रहा है, it is a monophasic. अगर ये पॉजिटिव में भी जा रहा है और फिर नेगेटिव में भी जा रहा है, फिर पॉजिटिव जीरो आके पॉजिटिव में जा रहा है, नेगेटिव में भी नेगेटिव में जा रहा है, फिर at this line वो आ रहा है, that means it is a biphasic. So from the baseline, from where this current started, if it is going toward the positive, coming toward the negative, both is happening, that is a biphasic. ओके, सेम पीरियड ऑफ टाइम होना चाहिए. डीसी इज यूनिडायरेक्शनल और मोनोफेजिक, बैटरी वाला करंट व्हाट आई एम टॉकिंग अबाउट. बट एसी प्रोड्यूसेस वेव फॉर्म हैव टू सेपरेट फेजेस ड्यूरिंग ईच इंडिविजुअल साइकिल. एक जो ड्यूटी साइकिल होता है उसका, ये कंप्लीट वो नीचे भी आएगा देन ऊपर जाएगा. दिस इज एसी. बट डीसी गो लाइक दिस. ठीक है, either it's a pulsed or continuous. Cycle applies to biphasic and pulse applies to monophasic. इतना अगर आप जान गए तो more than enough. Okay, cycle means sine wave जो होता है ना, sine wave AC current type, that is for the cycle. हम पूछते हैं एक साइकिल में कितना जा रहा है. बट पल्स जो है ना, it applies to monophasic, कितना पल्स आ रहा है. Okay, it's a monophasic. Now waveform के shape होते हैं. You would have seen that there are a lot of waveform के shape and every shape has a different we are going to talk like कितना कौन सा shape क्यों चाहिए, कैसे चाहिए. Either it's a sine wave, or you would have seen the rectangular wave, or you have seen the trapezoid wave, or you have seen the triangular wave. So every waveform has a shape. Okay, biphasic waveform may be symmetrical, may be asymmetrical. Phase duration क्या होता है? Pulsatile waveform conduct as a series of pulse of short duration and may be either monophasic or biphasic. It's a sum of all phase plus interphase interval, a short period of time where current is not moving. So it's very easy. You can understand phase duration कितना इसका एक conduct a series of pulse of short duration. ऐसे इसका phase का क्या duration है. Okay, what is the phase width, phase duration. Interpulse interval क्या होता है? दो phase के बीच का जो वो है time है. This okay, दो phase के बीच का जो time है, interphase interval, important. Amplitude, as I told you earlier, is for the intensity of current. Pulse charge, amount of electricity being delivered to the patient during every pulse. Rate of rise, decay, किस rate से it goes from 0 to max. Amplitude, you understand what it is. Amplitude is something, suppose this is a sine wave, so like this is a sine wave, it goes like this, come like this. So यहाँ पे ये जो है ना, वो कितना ज्यादा वो मतलब डिस्टेंस कवर करता है और वो आता है. Clear? So amplitude and then pulse charge. हो गया. Accommodation. Accommodation is very important concept, because suppose sometimes your patient will tell, sir, I'm not feeling it. He is not feeling or she is not feeling because you have not. But if you reduce or increase a little bit, again it starts feeling, because the nerve get accommodated over the period of time with the single kind of stimulus. अभी आपको देखिए यहाँ पे दिया हुआ है phase width modulation कैसे करते हैं, and what is the basic picture. Here in the basic picture we'll see. See, in the first figure, 50% is a zero current. Okay, no current is flowing, but 50% there is a current flowing of 3 volt. Okay, now, and then again 50%, again it is not, again it is there. So 50% pulse with 1.5 volt. Okay, 1.5 volt current. Why? Because 50% time it is not working, 50% it is working. Now coming to this picture, which is self-explanatory. 75% current is not flowing, 25% current is flowing. Again, not flowing, flowing. That means what? It is a 25% pulse width, we will say 25% pulse width. Okay, so 0.75 volt. अब आप पूछोगे 0.75 वोल्ट कैसे हुआ सर? बड़ा सिंपल है ना. देखो 50% ही करंट फ्लो हुआ, 50% में तो रेस्ट हो रहा था. So if current is flowing for the 50% time, 3 volt को you divide for the half, means 50% of that, you take it 1.5. So actual mein current is flowing with the 1.5 volt. Okay, but here what is happening, for 3 times in a, suppose you take 1 2 3 4, so 75% time current is not flowing, but 25% time it is flowing. So 3 out of 4 is not flowing, 1 out of 4 is flowing. So 3 volt का current तक एम्पलीट्यूड जा रहा है, तो मतलब 3 वोल्ट को डिवाइड बाय 4, 0.75. Actual effective voltage is this 0.75 millivolt. Very simple mathematics. Cycle. What is cycle? What is phase? Let us clear with the image. Very, very important image before we get into the machine. यहाँ पे देखिए, the phase, the current gone, again become 0, gone, become 0, and this is the baseline, 6 volt का baseline. So this is called pulse. This is called pulse. कितना pulse है? But cycle जो है, cycle will include what? Pulse also and the rest part also. Again, from where the pulse will start, it will be another cycle. ठीक है, फिर जहां से ये शुरू हुआ फिर वो अनदर साइकिल है. सो ट्राई टू अंडरस्टैंड. साइकिल अप्लाइज टू biphasic, phase applies to monophasic. Okay, some more examples we'll see. Image, sine wave, complex wave, triangular wave, square wave. This is how it looks. You can see complex wave में क्या होता है, there is a kink here, there is a depression here. But square wave, triangular, there is a trapezoid wave also. Okay, so yeah, Arti, definitely in all the language whichever is possible by me. So now this image is again very, very important for all of you. Reason is that it is a self-explanatory image and it gives you the idea of, see, this is the amplitude, as I told you, from baseline kitna, like how much it is going up, and again it is coming down from zero baseline, how much it is going again down, and this is called the amplitude. Pulse width, this is the pulse width, just now we saw. And what is pulse cycle? Pulse width plus when the current is not flowing, again flown, gone like this, again from here, and from that, you know, to start from the next pulse, whatever is the part is called pulse cycle. Okay, now interpulse frequency is what? Between two pulse, interpulse period, between two pulse, whichever is a period, we say as a interpulse period. But again, it will be either with the positive or with the negative. You cannot say that itke or iske beech ka, not between this and this. No, this number one, number two in positive, either number one, number two in negative. So between that is called interpulse. Why interpulse is important? Just to have a concept clarification. Okay, some observations I have made. Spike waveforms have better excitability for nervous tissue. Spike waveforms have better excitability for nervous tissue. More rapid increase in amplitude or rate of rise, greater current ability to excite the nervous tissue. Combining high peak with short phase duration, small phase duration, and very rapid high peak, that is something comfortable for sensory motor and pen fibers. Very important. Okay, but you see, short duration and high amplitudes, it is a character of DC generator. Okay, twin peak spike we say. You will understand more when you read about this. Sine waves are gradual increase and decrease in the amplitude for biphasic, monophasic, and pulsatile currents. So this is where I have shown like in basic idea. It's a self-explanatory. Again, you can see intensity or voltage on the y-axis, in the timing will be on the x-axis. This is the alternating current, by we say as a biphasic. This is the variable, either sometimes down, sometimes up. This is a direct current, and pulsating is always like this, pulsatile current. Most of the time we are using the pulsatile. So pulse duration, pulse frequency is something, how many number of pulse in a second. Okay, and this is my own observation. You'll find in the PPT if you want, or you can see in the YouTube also, you can read it. So there is nothing like a medium frequency. It's actually in the reality in the group of pulses combined as burst that range in the frequency from 100 to 200 pulse per second. Current modulation, a very good important concept. The type of current modulation, how can you modulate the current? How can you vary the current? You can vary the current, either you can take it as a continuous, burst, beat, ramping, all these types you can modulate the current. Continuous current, you know very well, amplitude of flow of current will remain same for several seconds or perhaps minutes. Okay, ramping modulation is something where the surging modulation current amplitude will increase or ramp gradually to some preset maximum and may decrease after some time. That is called the ramping one. Then you have a burst modulation. Burst modulation you should understand in a very simple manner. What we are doing, we are giving a intense में होता है ना burst, हम लोग क्या करते हैं उसमें small packets देते हैं, packets of pulse duration. It will go, okay, और बड़ा तेज देते हैं, it goes very high, fast. Short duration में it goes. So it is a very good for very good for certain kind of pen removal. Okay, we'll see which kind of pen. It has an effect of muscle contraction. Okay, it doesn't have effect of muscle contraction. As I told you, like it's very fast, and so it is almost not able to excite the muscle in visible manner. Beat modulation, it will be produced when two interfering biphasic current waveforms with differing frequencies are delivered to two separate pairs of electrodes through separate channels with the same generator. You know, IFT, all of you know that one medium frequency current is coming like this, 4000 hertz, and another is coming 3800 hertz. Difference of that will be 200 hertz, and less frequency will be more intensity going deeper into the tissue. And this is how on the base concept of beat frequency the IFT works. Circuit, you know very well circuit, like you have to complete the circuit and all, many resistance, parallel, series, and all those things. We are having any kind of circuit. Suppose you have a circuit, a resistance. This is a R1, R2, R3. So when we take a combine this R1 plus R2 plus R3 series, and there is a parallel also, like, so these all are circuit. Why it is important? If you are a practitioner, you understand R1, R2, R3. In that, what happened? Combined R1, 1 by R2 plus 1 by R3 will be the resultant resistance. Okay. So there are two methods usually, series and parallel. That's how the machines are designed with. In our home, it is a parallel circuit. Normally, there are certain principles. The principles which we explained just something like related to that we explained just now, and another only from my side, it's hardly 20 minutes of class. After that, your questions will be taken again, and I'll be asking questions, to be very clear. Effect of electrical charge in tissues in general terms depend upon the rate of electrical pulse. Always remember, if there is no change, only a very slow change, the current is unidirectional, the steady flow of ions, and will cause the chemical changes at electrode tissue junction. So most of the time, these changes happens because the electrons which causes the electrical current at interface which activate the molecules, and the activation in the molecules, activation in the blood, activation in the local area will be totally different for different tissues. Okay. Frequency, if we increase the frequency, you have a better effect, but again it depends upon the condition of the skin. Okay. More frequency if you do, I mean to say, like a more contraction if you want to take, then you have to think about the frequency, because it all depends upon the muscle contraction, which is the concept of repolarization and depolarization. Okay. So process of summation of contractions, like that. Okay. So there are something called the twitch contractions and the chitinization of contraction fiber that is rich, so that you may not be able to distinguish with every this one. So what I mean to say, the principles are varied. Okay. And tension developed by the muscle fiber is tetany much greater than the tension from twitch contraction. So muscle fiber tetany is strictly a function of the frequency of stimulating current, is not depending upon the intensity of the current. Okay. There are many things in this, and especially if you come to the like a muscle fiber contraction, if you want, you need a high frequency current. Okay. And if you want, suppose swelling is there or edema is there, for that always use low frequency current. Okay. Now if you want to excite nerves, you can excite similar intensity with the similar intensity current, just to increase the length of time. More the length of time, more nerve fibers will be excited. Okay. So like if we talk about, just 1 minute, if we talk about polar effect of electrodes, as I told you earlier, it will depend upon the tissue, but chemical effect, ease of excitation and direction of current flow. Okay. Chemical effects, right from the pH, to reflex vasodilation and ability to facilitate movement, what we say as what we are using as an iontophoresis. The tissue stimulating effect is ascribed to negative electrode with no longer pulse current more than 1 minute. Okay, bacteriostatic effect, if you can achieve, that will be either electrode, anode, or cathode with intensity of just 5 to 10 milliampere, also in more than 30 minutes time with high voltage pulse current. All these things we are going to see in the machine. Okay, like which kind of current. So electrode placement, you all know: bipolar placement, quadripolar placement, crisscross pattern, vector pattern for different conditions. Physiological effect, you know, nerve tissues, what is that? Absolute refractive period, depolarization, action potential, resting potential, voltage sensitivity, permeability. Muscle tissue, either all or none law or denervated muscle. We are going to see in SD curve how it works. And this is the refractory period, one of the image. You can see in the image, you have in the single image, you have both refractive period, means the voltage and voltage versus time, where the stimulus picks up and then takes to the higher level, I mean the depolarization, then it comes down and then come again the normal. So what is that? Absolute refractive period, where actually the stimulus is able to depolarize it, right? Again it get repolarized and come down, means that is the refractive recovery, relative refractive period, which is actually in terms of when it comes down and after repolarization that happens, means the potassium comes out, that you know. Now this image is important. Reason behind it actually says the resting membrane potential for both nerves and muscle, and that's the reason why current is differently we are using. Accommodation rate in nerve is always higher, so it senses very well compared to muscle. And pulse duration, what we are using for the nerve always less, shorter duration, but for muscle it's longer. Intensity needed, always I say for nerve it is a higher intensity, since pulse duration is short. Okay, but pulse duration is longer in case of muscle, so you need a lower intensity to see the to elicit the muscle contraction normally. Okay, strength duration curve, some of you, like one or two of you asked me strength duration curve actually. Okay, so basically strength duration curve I will show you from here only. Don't see this image. First you try to understand what is strength duration curve. Strength duration curve, what is the advantage? You are able to know what is the condition of the nerve, whether it is a whether it is a innervated, or it is a denervated, or it is a partially innervated. That is the function. That is the real actually advantage. But what is the disadvantage? You can know which muscle to pata chal jayega, but you never know about the site. You will not be able to know which site it is denervated. That is a disadvantage. Okay, so how to do it? Please take the machine. Which machine you will take? Constant current or constant voltage, any machine you can take, but I believe that constant voltage machine is good. Anyway, suppose and always use the galvanic current. So you have chosen the galvanic current machine, constant voltage, and then second thing what you have chosen, the muscles you have chosen, which muscle you have to try it. Third thing what you did the proper placement of electrodes, right? Everything you did. Now after doing this, what are you going to do? You have selected red wala electrode on the active, like innervating, what we say the motor point, and black wala electrode where we are going to keep, you are going to keep on the to complete circuit where you have to keep wherever you feel that nerve is coming out. Okay, suppose I am doing for the quadriceps. In that case, you can keep on like in the muscle belly itself, but you need to choose active for the innervating part, means the red wala electrode you should choose for the motor point. Now I will use the 300 millisecond duration current, correct? And I will check what is the intensity. or what is the voltage on this? What I will find, if I am getting the plot like this, means at 10 milliampere, you are able to see just the contraction, minimal observable contraction at 300 milliampere. Okay, 20, 10 hai, 30 hai, 40 hai, like that. And you are able to get this kind of graph. Okay, the graph, ultimately you have taken data and after that you have made a graph. You are taking like this. This is a symbol of innervated. Okay, समझ गए मेरी बात को? लेकिन now we will see the denervated. You will see what, with higher duration current, it is getting innervated, getting excited, but lower duration current, it is not able to excite. It is not coming only. Lower duration current, it is not coming. No, nothing is coming. I mean to, sorry, lower duration current is not able to give the muscle contraction. So this is the symptom of denervated. If the graph comes like this, it is a partially innervated. समझ गए ना? Partially innervated. This we say as a kink. Okay, this particular part which comes now, it's a kink. Half the muscle is innervated and half is not. So the maximum duration of the current which is able to elicit the contraction with minimal intensity is what is called as रियो बेस. यहाँ देखिए रियो बेस है ना, मिनिमल इंटेंसिटी जो है वो पता, उस पे जो है मसल कंट्रैक्शन आ गया है विद द मैक्सिमम वोल्टेज ऑफ द करंट. दिस इज द रियो बेस. नाउ रियो बेस को डबल कर दीजिए, 2 into रियो बेस कर दीजिए, मतलब 0.7 था 1.4 कर दीजिए, एंड देन यू चेक व्हाट इज द ड्यूरेशन डाउन, दैट इज योर क्रोनैक्साई. Very simple. Though then the duration of the current which is able to excite, able to get excite, able to stimulate the muscle with the amount of current is chronaxi. Double the Rio base. Double the Rio base. Double the Rio base. देख लीजिए 0.7 if it is there. 0.7 अगर है, इस पे Rio base बना था. Rio base is what? The duration of the current which is able to stimulate a particular, contract a particular muscle with minimal intensity is Rio base. Jitna minimal intensity आया, just multiplied by 2, and you check from down, just have an imaginary line down and check what is the voltage it is, like what is the duration it is catching, what is the duration it is catching, that duration is a chronaxi. Simple. Okay, chronaxi and uska ho gaya concept clear. It's very good concept. Types of current I have given Faradic and galvanic kind of comparison. To be precise, you can see galvanic current continuous, direct, and it's a biphasic. Faradic, and of course short duration, less than 1 millisecond, but here it's a long duration, interrupted DC. Your galvanic current and other differences you all know, and if you don't know about like these things, anyway we'll be keeping in notes. If it is possible, I'll send to every one of you. And source, you know very well, battery or electrical. Innervated, we are using Faradic. Partially innervated, which is the neurotemesis. I mean to say, like denervated conditions, we are using what? We are using galvanic. Sensation wise, it will have a tickling and flickering sensation, Faradic, but burning and hammer hitting kind of sensation will come into the galvanic. Okay, erythema can come into the Faradic. Reflex vasodilation is possible in galvanic. Okay, so denervated muscles treatment protocols. Now it's cool. Okay, these treatment protocols will be given to you. No problem. You can just see and how it works. You can see that treatment protocols. So Denervated muscles, as I told you, you have to go for the you should understand first what is how it present the symptom, and after that you have to select the current and go for that. So now after that you can go for the muscle re-education. How will you select? You will be able to select muscle re-education, pulse per duration, maybe 300 to 600 microsecond. Frequency should be again below 5500. Okay, muscle fatigue should be minimized, then only muscle re-education is possible. 1:1, 1:5, anything can be chosen. Treatment time not more than 15 minutes. In edema, as I told you, for edema reduction, what is the best? Pulse duration, what is the frequency is the best? We were talking that time also. It is 50 hertz maximum. Okay. You can keep on and off always. There is something called paradism under pressure also. So read about it. And there is a treatment protocol like 20 to 30 minutes. Okay. Use always in addition of cryotherapy if it is possible. Atrophy reduction. Atrophy reduction, you can keep the high intensity, but in the comfort level of the patient. Okay. And maximum voluntary ischemic contraction, you should be able to achieve 25% of that. So what is that actually? Suppose you are giving contraction, the bicep, it is able to contract. It's able to contract that much you are intensely giving, but at least it is able to contract 25% of the capacity. Okay, so MIBC, we say that concept MBIC. And then pulse duration, again 300 to 600. Don't get confused with pulse duration. Now it is machine, it is fixed. And frequency below 100, 50 to 85. On and off timing you must have with the pulse. Treatment time again 20 minutes. Better if you can go for 2 to 3 sets of 10 contractions. Here atrophy reduction means muscle, you have to focus more. Again, muscle intensity, if you are keeping current intensity high enough to go for 60% of maximum voluntary ischemic contraction, let me tell you, you are very close to muscle strengthening. Okay, so again, you should not have a treatment timing more than 5 minutes here, I believe. 5 to 10 minutes should be more than enough treatment timing. Range of motion, yes, range of motion is also possible through the muscle stimulator, where you have a high intensity as much as the patient can take. 40 to 60 hertz of current should be selected. You must give a pulse like 1:1 or 15-20 second off minimum in between. And surge current must be used. You should not tell the patient to move the limb. Okay. Treatment timing should be more here because you are using the Russian current, kind of little high voltage current. Okay, so in that case, what happened? You are stimulating group that should be antagonist to the contracture or the joint contracture or the patient position must be adopted in such a way that joint will be moved to limits of available range of motion. However, it looks theoretically right, practically difficult, but if you start doing, it is possible. If you are talking about TENS, yes, some of you were wanted to know about the TENS as well. See, we are in our clinical, there are a lot of, in machine, it is itself is very confusing. You will have a lot of type of TENS, which to use, which to not. Blink your eyes and use conventional TENS if you are not understanding anything. In clinic, conventional TENS is used more and more. No problem, you can use it. I'm telling you, no problem. Okay, intensity in the comfort level, of course, you will keep, but frequency should be 125 or 150 or up to 200, no problem. But asymmetric biphasic waveform comes and 30 minutes of. So what happened here? Always remember, my dear friend, frequency and intensity goes almost inversely proportional. Almost means if it is a more frequency, more the frequency, intensity will be less. Less the frequency, intensity will be more. So what is happening here? Frequency is more, so intensity is less. See, suppose I'm having a headache and I'm pressing it. Headache get relief. Why? Because mechanoreceptors goes to the brain, blocking the blocking the local nociceptor, right? That we say as a pen gate theory. Same way TENS work, nothing else. So it is good. It's a good protocol to use conventional TENS, which is about having a more frequency and less intensity. So if you plot that, it will have a more pulse. छोटा छोटा pulse होगा, small pulses, but more in duration. ठीक है? So this is a conventional TENS is good for the clinical purpose. When it comes to the low frequency में क्या होता है ना, high intensity आ जाता है. So here if you see, just 1 minute, here if you plot, if you see that, suppose if you see the graph, no, it's always get clear. You have a more pulse duration, ठीक है ना, more pulse duration here. So less frequency and more intensity. Less frequency means more intensity. More intensity means you will be find some of the muscle stimulation and muscle contraction आ जाता है इसमें. ठीक है, ये भी आप 30 minutes कर सकते हैं, especially on the trigger point and acute conditions. You can try this, no problem about it. Okay, at lower intensity or high enough to increase. You should not have muscle contraction, to be very clear. It's not like that muscle contraction is happening. That's not proper tense. That's a low tense. You should not have a muscle contraction. You should just have a visible muscle contraction, but you try to keep that much intensity. Okay, because whenever you are choosing low tense, muscle contraction will come. The reason I told you, low frequency, high intensity. अभी नॉक्सियस लेवल का टेंस है. नॉक्सियस लेवल के टेंस में अगेन इट इज अ लो टेंस ओनली. ओके, इट्स अ लो टेंस ओनली. 100 and 2000 ऑफ माइक्रोसेकंड्स का पल्स ड्यूरेशन ज्यादा होता है. सो इन दैट केस आल्सो यू कैन यूज फॉर डायरेक्टली ऑन द एक्यूप्रेशर और ट्रिगर पॉइंट्स ओनली. ओके, आई थिंक अच्छा बर्स्ट के बारे में नहीं है. ओके, आई थिंक आई फॉरगॉट टू कलेक्ट द बर्स्ट. दैट्स द रीजन आई टोल्ड यू आई विल एडिट एंड गिव यू. So burst, there is something called burst trend. Burst होता है ना, मैं बताऊंगा. Burst is the most useful when it comes to the clinic. Okay, burst is the most useful when it comes to the clinic. इसमें क्या होगा, इसमें क्या होगा, 1:10 इतना packets of stimulus will be given. 1:10 packets of stimulus will be provided, and इसका frequency भी 50 to 100 hertz ही रहेगा. It's not more. Okay, but 50 to 100 hertz के बीच में if you are using a TENS, and इसका क्या फायदा है ना, it gives the burst like this, it gives very fast, frequent भी है, it is having a good frequency, and packets of burst, packets of stimulus is going. That's what we say as a burst TENS. Okay, so intensity भी high है because comparatively इसका ये low है frequency, इससे सब level maintain है, और burst की तरह you are trying to send it. Okay, packets of stimulus, so it works very well. There is something called brief TENS. I think few of you would have heard about brief TENS. Especially after surgery and all, we use that. Especially after surgery and all, we are using that, and it's one of the it's a here intensity, it is a little higher, 20 to 30 milliampere, but it is very good for pen control. Okay, so frequency also 50 to 100s ही रहेगा. ठीक है, so brief TENS is used mostly post surgery, and after that you come to the microcurrent, means what we say very low intensity. Okay, and very low frequency. So what is the use is analgesia, fracture healing, wound healing, ligament and tendon healing. So tissue healing के लिए ना micro TENS use करते हैं. What is the parameter? You see the parameters. Pulse duration पे मत जाइए, it is 1 to 500 millisecond. It's a decent pulse duration, no doubt. Frequency is not more than 50 hertz, and you have intensity less. So what happened? You are just keeping it and leave that. Tissue healing is going on. Okay, leave that for about half an hour, 40 minutes, like that. Okay, there are a lot of things in this. Monophasic is better than biphasic, but nowadays you have a selected machines. So see, treatment time, I told you, you have to just keep it with the patient, and for tissue healing you should leave. You cannot expect in 10 minutes or 20 minutes, 2 hours followed by 4 hours. Have you ever heard about it? Okay, and now one more beautiful thing you see: negative electrode in wound area for 3 days. Positive electrode should be positioned 25 centimeter proximal to wound. After 3 days, polarity is reversed, positive to be kept in wound area. So I told you to refer the low and read. In that you have some insights related to that, how tissue healing get progress. Okay, infection is not reducing, then negative electrodes to be left in the wound area till the infections are not evident. However, it is a little higher concept. None of us are using it in India. Fracture healing, as I told you, again, tissue healing is a part. So what will happen? Here again, we will be using what? We'll be using the like low pulse duration, low frequency current, so that the intensity is good enough. Okay, and monophagic, obviously, tense, biphagic intense, again burst kind, low tense, and 30 minutes to 1 hour, 3 to 4 times in a day. Fracture healing ke liye it is a very good. Crisscross pattern is used. Results are seen on the monthly intervals. Okay, so there are some research insights here also. Medical galvanism, iontophoresis, all of you know iontophoresis is about uses of direct current, and since quite some time that it transport ions from heavy metals into the skin infection or through the counter irritating effect. So normally in treatment protocol, we are using what? We are using the low volt current. Obviously, we are using the low volt current. We are using the continuous monophagic current, and then of course low voltage monophagic should be chosen. Okay, and treatment time is 15 to 50 minutes to the max. Skin should be unbroken. That's very, very important. Equal size electrodes must be used over gauze that has been soaked in saline solution and lightly squeezed. For better connectivity, we are using that. Okay, so iontophoresis basically it's a technique where that involves the introduction of ions into the body tissues by direct current. Okay, and you are using different materials for this treatment techniques. As I told you, 3 to 5 milliampere short duration, short intensity current, 10 to 20 milliamp minutes of this one, and total drug delivered, if you want to calculate the amount of total drug delivered. So here we are calculating as a milliampere dose. So 40 milliampere dose, if the doctor has written 14 milliampere into 10 minutes, that's how it is calculated. Okay, electrodes must be disposable and ready to use, metal ones also, but you have to cover with a sponge or electrode. Now coming to the very important graph, and we are almost at last 2 minutes of my class. Negative electrode, somebody is asking question. I'll take by frequency PTA then. I'm trying to check some of the messages. So body fluid contains oil. Here we see like if we see like how it works, you can check. Just 1 minute. Here you can check. Body fluids, normally what happen? It contains the ion, mostly sodium and chloride. Okay, if it is a positive electrode, polar effects of the anode, current takes away the electron from the anode. Each chloride ion loses an electron, and to become a chlorine atom, chlorine reacts with water to make hydrochloric acid, an acid that acid effect of the active electrode. That is the reason of acid effect. But when it comes to the alkaline effect of the active electrode, how it is? It goes to the cathode, polar effect of cathode, current delivers electron to the cathode. Each sodium ion gains an electron to become sodium atom. Sodium reacts with water to make sodium hydroxide and hydrogen. That's how the alkaline effect. Now the thing is like sodium ions and chlorine ions by using the saline water. But what is the use? Why did we use? Because for different, to gain different purpose, to fulfill different purpose, you need to have that. So for analgesia, lidocaine and magnesium. For edema, magnesium hyaluronidase and salicylate. For burns, antibiotics. So all these things can be used. There are many examples I have taken, like rotator cuff, you are using dexamethasone and lidocaine just for reducing pain. For plantar warts, like you are using sodium salicylate. For epicondylitis, dexamethasone. So these all are used like in antiphorsis in for like European countries and Western countries. But in India, how much it is permitted as per the doctor, as per the medical council rule, or as per our council rule, we have to go according to that. Positive and negative, as I told you, like will have a different effect. So you choose different chemicals for positive and negative, especially for the athletics. Okay, so that's how we concluded. Contraindication, obviously, skin sensitivity reaction, sensitivity to spleen, aspirin, stomach ulcer, asthma, bacquial, sensitivity to metals, zinc, copper, etc., sensitivity to seafood, iodine. So this is how we concluded. Next is spinal traction, which is not part of today's lesson. So we have completed. So we are in last part of the class. I would announce, I think I would announce, or sir will announce just 1 minute. Sir will announce the code in some time. So just 1 minute, I'm checking it out. See you, sir. Well, okay. Pritam, okay. Well, your question was, can it be given on the metal implants? Look, few places I have read, yes, you can. In fact, when I was talking now also ultrasound, yes, you can. But I would say that directly on the implants, never ever use the ultrasound directly. Now, as you know about the depth, half value depth and depth of the ultrasound it can get into, you consider your joint and then you can do it. Suppose somebody has implant in right leg, you can obviously use on the left leg. Got my point? That's how. But electrical current, 100% you cannot use on the implants because it collects the charges. Okay, I have a question on WhatsApp. Please send the questions here. Don't send me on WhatsApp group. Yeah. Sir, can we? What is the question? I don't understand. Question is like, which current is the best for? What is that? Which current is the best for low back pain? Well, see, I told you, low back pain or any condition for matter of the fact, you need to check what? You need to have a proper assessment. If it is an acute, you have to make your clinical decision. If it is a subacute, you have to make your decision. If it is like a chronic, you have to make your decision. So it all depends upon the conditions. It all depends upon the how do you make your clinical decision depending upon the assessment. All depends on assessment. Nothing, we cannot say that this is best, that is not. But obviously, okay, same person is having a second question. Please ask your question on the app here, then I will take certain questions from YouTube also. Okay, well, okay, the question is like, can we use IFT for the neck pain? Again, the question is itself is answered. We need to find out what is the condition. I mean, why are we willing to use IFT for neck pain? If the pain is deeper, IFT is good. If pain is superficial, TENS is good. This is what has been told to us. Now, someone asked me some time back, can we use IFT, TENS for the weakness? I would say yes, you can use, because ultimately it gives you soothing effect, calming effect, and it makes you more. फ्रोजन टेंसर में टेंस एंड अल्ट्रासाउंड यूज कर सकते हैं, क्यों नहीं कर सकते? बट इफ यू send any patient to me, I personally don't use any gadget for frozen shoulder. That's a different matter. But as long as If you have an acute condition coming to you and then you are using that, please use that. Okay, what is the duration of TENS and IFT is ideal? This makes sense. Well, it depends upon the condition. Wait. I'll answer that question first. It depends upon the condition, and moreover, is there an acute condition? People think that we will give more amount of time, it will work. It doesn't work. It doesn't work. Okay. You need to choose appropriate, say for example, 15 minutes of time. Okay. You can carry on 15 minutes of time. And if you want like a 20 minutes of time, you can, but you can't giving a half an hour. But one thing I'll tell you, as we saw now also, like TENS we can give for larger duration compared to IFT. Okay, so pointed pain, chronic pain, dull pain, and which is troubling you, which you think that is coming from the deeper part. Okay, so yes, you can use the Pritam Haldar. Your question is, I have heard that ultrasound therapy can be used for healing the hairline fracture. Where have you heard? Number one. Number two, wherever you have heard, it is good. You have heard correctly. It can be used, no doubt. But again, you have to be careful. You should not use for the epiphyseal plate of the bone. Okay. What is more effective, TENS or IFT for cervical spondylitis? See, for me, it is, if it is, it all depends upon the assessment. If cervical spondylitis is of like the pain is spread around the muscle, I am very clear TENS is better. But if pain is concentrated in certain region, it's not going, you can use IFT. But only depends upon what kind of exercise you use along with that. TENS used in paralysis conditions, you can use it. But better you use some of the electrical stimulator. Ultrasound for hams with varicose veins in calf. We discussed we should not use ultrasound over the DVT area. That doesn't mean that we can use the ultrasound in area away from there. Okay, can we use for electrotherapy for pediatrics? Pediatrics, I personally don't use, but again, it depends upon, suppose somebody came like an 8-year-old boy and then have a like an ankle a kind of a crack, hairline crack, and ultrasound is supposed to be given. I would not use personally. If you are asking me, I mean, of course, it's the matter of complete electrotherapy after 35 classes, what we are discussing, you are asking me. But yeah, I would answer you that I will not use ultrasound. I will definitely not use ultrasound. I will use what? I will use the wax therapy. I'm telling you, I may be sounding old, I may be sounding classical, but yes, I would use wax therapy. In fact, we are one of the like there are few physios only nowadays they are using wax therapy. I don't know why. Radiculopathy pain, you must use IFT better than TENS, but again it depends. For me, understanding of IFT and TENS is very clear. IFT is somewhere where the pain is little deeper and it's a kind of pain of stiffness, kind of pain which is troubling more, and the TENS for the pain of the muscles. We need to check for 2 or 3 sessions. If this is not working out, we can change our treatment, but not IFT and TENS together, not required. Do for drop condition use the TENS? Why do you want to use the TENS in foot drop condition unless there is a pain? You should go with the muscle stimulator for dorsal tibialis anterior muscle, and most importantly for peroneal muscles if it is not working. Do electrotherapy like in severe cases where we have already achieved the muscle power of 1 to 2 NMES, after that neuromusculator. Yes, you can do that, but here your idea is to go for muscle stimulation. So my dear friend, think about LIS, okay, low intensity stimulator, which is your like a Heradic or anything which actually work for muscle more than the nerve. Okay, ideal duration of ultrasound, IFT, ultrasound, and TENS. Well, okay, ideal duration of IFT, ultrasound, and TENS. Again, it depends upon the condition, but let me tell you, ultrasound I explained very clearly. Right from the for the very acute condition, you can have just 2 to 3 minutes, 2 to 4 minutes. If it is a subacute, you can go for up to 7 minutes, 6 to 7 minutes. But when it is a chronic condition, you should go with the 8 minutes to the max. But again, it depends upon the pulse and intensity what you choose. In ultrasound, pulse selection and intensity selection is very important as per the condition. If it is acute, your intensity selection should be very low. Okay, and it should be pulsed 100%. When it is chronic, you can choose pulsed and continuous both. Your intensity selection can go up to 1.5, 1.6 to the max. But again, it depends on the joint and the kind of stiffness and the kind of, that's the reason you are making M, right? According to your M, it can go. So what is the strength duration relationship? I explained very clearly, Preeti Pandey. About strength duration relationship, SD curve, we need to check out. However, advantage is that it gives you the perfect idea about either innervation, denervation, or partially innervation, but it doesn't tell you which level it is or which site is damaged. So here what happened, we plot a graph where we are taking a duration machine, I mean the constant voltage machine, we are taking galvanic current, we choose, we start from the 300 millisecond duration current. Suppose I have chosen the bicep. In the little resting position of the bicep, we are giving a current. Suppose 10 milliampere current, first time you saw the minimal visible contraction. Remember that visible contraction, you need to check the same amount of contraction with every duration. 300 has given a 10, okay, that we will say as a Rio base. And 20 milliampere of the current, it will give you what? 20 milliampere current, it will give you what? Chronexi. You need to check which duration it came. Okay, so strength duration relation is really very, very important, as you asked me. I will go with the just 1 minute. I will go with the questions. There are few questions. OA of the pen, use the TENS and ultrasound. See, OA of the pen, you can go for the IFT for better effect, not TENS. If it is a muscular quadriceps and all is paining, you can definitely, but it's better you go for the IFT. And ultrasound, of course, yes, you can. Sir, what is your opinion about laser for pain reduction? Laser we haven't studied today, and I don't use personally laser, but I heard that it is supposed to be one of the good things. I don't use laser personally, so today it is not a matter of discussion, so let's not talk about it. Parameters, and in fact, all of you can ask your question. Very soon we are going to start a portal. Ask your question, especially for the student. It is free. You can ask your question. One day in a week, we will sit together, like especially on the Friday evening or Sunday morning, and we will discuss all your questions. All questions in your physiotherapy, either me and other senior professors will be there who will be answering for you. That we are planning that particular portal. Give us some time. Parameters and doses of ultrasound in case of hairline fracture. Very well. Again, hairline fracture, if it is not near the fascial plate of the growth of the bone, you can use it. And again, repeating it, growth plate, you cannot use it. Hairline parameters, again, it depends upon, see, most of the hairline get healed within how many? 3 weeks to the max, right? So if you are using ultrasound before that, obviously you need to use very low intensity. Depends upon your machine, which you are using. If it is a 1 megahertz, I don't think 1 megahertz is used unless it is a deeper structure required to be healed. On patella pain in the knee, should be ultrasound given? No. No. Not required. Then patella pain is there for what reason? You need to find out. Okay. Bone in the patella cannot pain unless it is like a fracture or something like the case. If fracture is there, it has broken, comminuted fracture, K-wire will be there. How will you give ultrasound? However, is there not been done, then if you have any arrangement where you can put the knee in the water, then you can use that method what we explained today. Okay, can we go ahead with our golden old modalities or advanced modalities coming nowadays a lot? Well, golden, you have written all the golden, golden word before old modalities. That means you are really liking your old modalities, no doubt. You can use that as well. And then advanced also. Advanced is what? Advanced is either it's a digital or it makes your work more easier with a timer where it actually affects you better. Somebody asked like whether we can use 2 modalities at a time. See, I have seen in few hospitals during my training days, they were using 2 modalities at a time. But I am 100% against this. This is my personal view that we should never ever use 2 modalities at a time. What is more effective in kyphosis, TENS or IFT? Nothing. In kyphosis, your exercise, posture correction, gait, everything is important, not your machine. Now, however, I know your question is what? Your question is like for pain, what we can do, right? You can use the TENS. TENS also for the 4-channel TENS you can use for kyphosis where you can spread everywhere, but with your exercise, it works very well. Now, thanks, a nice class. Thank you, Vimal. Arunachalam, thank you, sir. The class was so informative. Thank you, Arunachalam ji. Some more questions were there on top. Okay. Effect of electrical stimulation in spastic muscle. Please don't use it. Please don't use it. That's what I thought that there is a one very important question is there. I was missing it. Please don't use it. Spastic muscle, don't use it. Not required. Do as much as good exercises you can do as much as ADL activities you can do, functional activities for them, but don't use your these things, not required. Lot of good techniques are there for spastic muscles. You can learn from our academy also. I think Arunachal sir has explained very well. Majority of you had joined that day also. He has taken 2 or 3 times functional activities classes, and it was wonderful. So you have a lot of things. Don't use that. Not required. Maybe for the flaccid condition you can use for some time, but not for the spastic. Karthik Raja, I feel I'm clear about your question. Now, anybody else? Kyphosis tense. Okay, clear. Stent duration relationship clear. In CVA cases, foot drop reduction, I think clear. Beneficial ridiculous, clear. Forehands clear. शोल्डर में टेंस अल्ट्रासाउंड यूज कर सकते हैं, क्लियर. कैन अल्ट्रासाउंड पेटल इम्प्लांट्स, क्लियर. सो आई हैव एक्सप्लेन्ड ऑल योर क्वेश्चंस. इफ देयर इज एनीबडी यू कैन answer me. I mean, you can if take care done since ago and patient has pain in knee, modalities we can use. I think I answered you earlier. Thank you, Sakuraji. I think I answered this. Upashna, can we use TENS or US implantable cardio defibrillator patients? Look, we need to check out whether there is a is there any pacemaker or something. Of course we cannot use. And then second thing is, like, we need to check out the sensitivity. We cannot use defibrillator, cardioverter defibrillator patient. I would say no. Ultrasound 100% no. Yes, TENS we can think of depending upon the conditions. No questions, all clear. Thank you, Naslam ji. Please reply. Rasmika, you can ask your question. Rasmika, I didn't see your question. Please, you can ask. Khushi is asking khatam kab. Okay. Okay, in which all cases we should use active word tense? See, as I told you, I think I have answered this, Pritam. More of concentrated deep pain, use IFT. Okay, number one. Radiculopathy pain, referred pain, you can use IFT, no problem. Tense is basically the muscle pain. Okay, and where exactly the muscle get weaker, where you have pain because of weak muscle, use TENS. Mark my word and what I'm saying you, where you have pain because of weak muscles, use TENS. Pain cannot always be because of nociceptor stimulation or something. No, it could be because of weak muscles also, right? Patient is suffering from hemiplegia, pain in low back. Electrotherapy should be used or not? Why can't you use? 100% you can use. Is there any metal implant? Which modalities can we use? That's what I think. Okay, Rasmika, I answered this many a times that modalities depends upon the location of modalities. 100% you should not use current modalities in that. Ultrasound, yes, you can use, but little away from there, and then you should keep moving your machines. It won't have a problem. Is there any, can we use ultrasound on nerve transplant surgery? Why do you need ultrasound on nerve transplant surgery? Not required. Especially in laminectomy, in all those situations also we say ultrasound not required. Can we use TENS in one case of nerve block? Nerve block. Nerve block is a different thing, Rakshita. You are asking about the pain due to nerve block? Yes. Does IFT effective on long area? Yes, it is effective depending upon how you select it, but TENS is better. Any evidence-based practice on ultrasound in humans? Please search there are various books. There are various books you can search. Evidence-based practice. Can we use TENS on plantar fasciitis? You don't have to use TENS on plantar fasciitis. Do good exercises, use ultrasound, and use some of the oil, kind of techniques of making it soft, and do exercises. Human beings ultrasound using is not at quoted edge. I have no idea. Okay. Yeah, see you, sir. It's in animal practice. I'm in human biology. Your sound is not clear, sir. I'm done from my side. Thank you everyone for participating. I would exercises will be more effective, lumbar spondylolisthesis. Okay. And for just pain, you can use your like TENS or IFT, depending upon the body of the patient. But I would say that prefer more exercises and posture. Yes. Yes, sir. Please tell me, sir. Your voice wasn't. Yeah. Now it's the time of your certificate. Please send. Please send this code to MRS 24/7 number 9066 990059. I hope all of you can see the code. MRA 83. MRA 83. Don't send with any kind of initials or dot space. It is a capital MRA 83. WhatsApp only you have to use and send to 9066990059. Thank you, Pramod sir. MRA 83. Please send through WhatsApp to. If you are sending normal message, it will not come. I have sent in the group itself. Sorry, in the chat only. Okay. And those who are not present now will not be able to see. You will get a link. You properly fill up your proper name, everything. Later, we will not take the name correction. Okay. So. Okay, repeating MRA 83. I have sent in the group, in the chat box, not in the group. MRA 83. Please send through WhatsApp to 9066990059. Message will get delivered definitely. Yes, link will come. Don't send multiple times. You just send code. You can copy again. You can copy the code. I'm again putting in the group. Sorry, I'm putting in the chat. Just copy this and send on the WhatsApp. Just copy and send on the WhatsApp. Many of you have got certificate and left early. Looks like everybody's hungry. Okay, those who have connected to the YouTube can contact me. I have a list of them. So I'll match and then give you. MRA 83. to 9066990059. Yes, MRA83. Don't make anything on this. You will receive the link, Pavitra. 100% you will receive the link. Message will get delivered, Anand. Don't worry. The link will work. Don't worry. You will receive the link, MRA83. I'm constantly giving it. You can just copy and send on the WhatsApp. And many people, they are asking me that it is not delivered. Let me tell you, it's basically the like lot of messages going, so it's not getting delivered. It will get delivered. Okay, it will get delivered. No, you don't have to mislead. It just see. Okay, chat. You are asking Pramodji, chat number 9066990059. Message will be received. Don't worry. It will take time. Many are actually sending messages, so it will. You said MRA free membership. How can I get? It's not actually the you can actually message me. My number, you know, right? 9008533336. Rosan Jabin. You can message me. I'll tell you how you get benefit. The free membership has been ended for everybody. In fact, now the membership which gives you more benefit than free. I don't receive link. Kusi, you will receive link. Don't worry. Again, you can do what? You can just use this code. Don't send multiple time. Just wait for your turn. The link will come to you. Ravina Verma, what happened next? I don't understand. Like, what is that about? I got link certificate 2. Thank you. Thank you, SSV. Any national recognition ID or ethical committee ID? ID regarding? I don't understand what it is. We have our academy ID. So, okay. See you, sir. I think most of them have got certificate. You will receive, Shruti, you will receive the link. Just don't send multiple times. Hours can be submitted to authorized. No, these all are the free classes. So here, this is a certificate of participation, certificate of your attendance. Obviously, you cannot use this for any sort of interview or something. It is just a part of the continuous medical education program. You are with us. That's it. Okay, it depends upon everyone's perception. I'm not here to only for certificate. We are here to, I told you in our initial minutes of discussion that we all students of physiotherapy meet here, and then we talk about it and talking about accreditation and all. You can go our website and can check it. No problem. Thank you. See you, sir. It's done. Thank you, Busra. You have been very regular with us. So thank you all. Thank you for your wonderful time on the precious Sunday. Thank you, Tarun. So thank you so much for your wonderful time. Now uh, we are going to meet for next class. So thank you, everyone. Thank you, CSR. Thank you, everyone. You will get the link. Thank you, Roshan. Thank you for your kind wishes. YouTube link, you can go to the My Rehab Academy. You'll find that link. My Rehab Academy YouTube, in you My Rehab Academy, only you search, you'll find it. Thank you, Rajesh ji. You'll get the link, Vinuta. You just don't send multiple times. Yearly subscription. Okay, well, you'll be getting that yearly subscription benefit in coming time, in a month. Very thank you, thank you, my Vichi. Thank you, Amit ji. Thank you, Jasila. You will get link. You will get link. Certificate benefit is that you are here to interact, so we are giving you certificate of participation. Thank you so much. Thank you, Devika ji. Thank you. Thank you.